Start them. Yep.
Oh, yeah, here we go.
We are recording. So we are. So we'll roll call. Ralph Harrison,
Here.
Toby,
Here.
Lois, here, Eric. Eric, I think he's on.
I saw it someplace.
Yep, we've heard his voice.
Yep, he's on Zoom.
And then Karen here. And then Jeff is not here, and I do not believe Paula is here.
Yeah, and I'm here too. Sorry, I couldn't get the mute button.
So. Were we expecting Paula?
I thought Paula was gonna make it, but we'll get started.
Okay. Approval of the minutes.
I moved for approval.
Second.
All in favor, say aye.
Aye.
I
Public comment period. Anyone from the public want to speak? I don't believe we have any public.
It looks like the Winnebago Citizen is on.
Oh, my eyes are bad.
Just call again.
Any comments from the public? Okay, then we're gonna move on. I know Jamie mentioned she needs to leave early. Could we, I don't know if she needs to leave early enough that she needs to speak now, or if we can get the first three done and then she does her portion when it's called. She's on clinic.
I'm just on clinic today too, and so just in case I had to leave or go do clinic, or if they pull me out, I just was wondering if I could be one of the first that went.
First before the amendments?
Yeah.
Okay. Sure, then Jamie, if you want to give your portion.
Sure. Like right now?
Sure.
Are we good for it? Okay. Okay, perfect. Okay. Well, I will give my portion right now. I would need to share my screen. Otherwise, if Julia, I don't know, she said she might share her screen to do the, I can share mine though. Here we go.
Whatever is easiest for you, Jamie.
I think this is easiest for sure. Okay. So can everybody see that?
Yes.
Yes.
Okay. Do you need it bigger or is this good?
If you go to presentation mode, like be easier.
Presentation, like here, that one. Okay. Okay, here is our crew or WIC crew. For anybody who doesn't know what's going on, I'm going to give a little presentation, a little deep dive into WIC today, and especially our particular project, Project 27. Here's our fabulous small but mighty crew down here. We do good things and it's going very well, I should say. And so, yeah, my name is Jamie Thibodeau. I'm the current WIC director or WIC program manager. And I will move on here. So what WIC is a supplemental nutrition program for women, infant, and children that provides federal grants actually to states for supplemental foods, healthcare referrals, and nutrition education. Most of the time we feel like caseworkers, of course, because we do way more than these three items. Most of us are dietitians. If we're not dietitians, we have to have a 4-year degree in nutrition. And so most people do not know that, but that is one of the requirements from the federal government, that they want us to be registered dietitians, at least one registered dietitian on staff. Supplemental foods, what does that look like? That looks like we give out the main items, the milk, fish, fish for pregnant women or breastfeeding women, eggs, beans, things like that. What we don't, fruits, veggies, what we don't give out is things like meat. We don't have a benefit for meat right now, which hopefully will change. And other things that, like with food share, in comparison with WIC and food share, you you can get pretty much anything, energy drinks, packaged foods on food share. With ours, it is a strict benefit guideline, and there's only certain foods that are allowed on WIC because of USDA guidelines. So, and that's all calculated with like women's needs when they're pregnant. That's how it's calculated. The guidelines of Healthy People 2020, and now it's Healthy People 2030. The data that's based off of that and USDA are kind of calculated into what needs a person would have. And that's how our benefit packages are cycled out. So does anybody have any questions on that? I know that can be confusing. I like interactive presentations. Okay.
I have a question.
Yes.
This is Karen Powers. Infants and children up to age 5, but you don't list how long postpartum, either breastfeeding or non-breastfeeding women are eligible.
Postpartum breastfeeding women, exclusively breastfeeding women, are eligible until 1 year.
Okay.
And non-breastfeeding women are eligible for 6 months.
Okay.
So
Thank you.
postpartum, yes, sorry about that. And that makes huge
You
sense. And
said it
that's,
does not cover pregnancy.
it does cover pregnancy, yes.
Oh.
Yep, covers pregnancy, but then postpartum, we do not cover anything past a year if they are not breastfeeding. Which, they are, again, WIC is kind of, after COVID, we're kind of looking to revamp the whole program right now. That's kind of what the federal government is looking at, and what our National Academy is looking at. And that is one of the things on the docket is, do we do this to 6 years old now too, is kind of on the docket, and do we do it past a year of postpartum, considering that the American Pediatric Association says breastfeeding should really be till 2. And so should we help women with their needs until the babies too? So that is a very good question.
Thank you.
Yes.
Amy?
Yeah.
How many people are we servicing, or how many people are in the program right now?
Right now, here, good question. And that's what this snapshot here of Winnebago County looks like for us right now. So our projected caseload is 1,994, but right now we are servicing 2,092. So wow. Yeah, 105% of our caseload right now. And so we are doing very well. And this has been a struggle up until COVID. And then once we did a waiver to allow people to have remote services, we saw a grave increase in participation, recruitment, and retention for all ages. That means even past formula age. And we were seeing only women go up until, 1 year old. And then once they had, they got milk on their package, or they received milk on their package, then that's when they would usually drop off because it wasn't warranted for them. The amount of the food package and the gas and everything that it would take to get into WIC was not worth it for them. And so now that we have kind of switched our gears and we allow people to do remote service, and the numbers don't lie right now. And we used to be at a 20% no-show rate. And as you see right now, we hold a 2.3% no-show rate. That means everybody that we are calling, we are getting a hold of, which is pretty remarkable, actually. In my years of service in WIC, I have never seen anything like how the last few years have been.
And
so
is formula covered? Is formula a benefit?
Yes, formula is a benefit. Yep. So we give formula obviously up until a year. And that can range all the way in the benefit package. That can range anywhere from, when they turn 3 months birth, obviously right off from birth, if they never breastfed, all the way till, hey, I'm breastfeeding and I need, I'm breastfeeding on demand, but I don't produce enough. Can you give me formula? What does that look like? Then we give a some breastfeeding package, that's what it's called, or a mostly breastfeeding package, where we still allow them to get formula, but it includes that, not trying to restrict them and their breastfeeding goals, I guess, is the goal to that. It's to allow them to have what they need without like, I don't know, kind of cutting them at the knees with breastfeeding, if that makes any sense. So
No, I don't know what that means. What do you mean cutting them at the knee? What do you mean by that?
like, okay, so with breastfeeding, if you have to breastfeed to be able to produce more breast milk, obviously. So if you give a participant that's a brand new mom too much formula and she utilizes that formula without breastfeeding, then it inhibits her breastfeeding goals. So that WIC has a hard time with over giving formula to a breastfeeding mom when they don't need it. So we go through kind of a vigorous process with them, with not trying to I guess gear them in a certain way as we want you to formula feed or not formula feed, but still allow them to have formula if they feel like that is a good backup. Does that make sense? But without telling them they're not good enough, you know what I mean? Or your body is not good enough to feed your baby. Does that make sense? Okay.
Well, sort of. Do you have a lactation specialist? Because for every ounce of, for a lactation specialist will tell you that for every ounce you're giving your baby a formula, that's an
Yes.
ounce your body is not going to produce. And eventually it's she says she doesn't think she's got enough milk. Giving her formula to back up will guarantee she will not
Right.
have enough milk. So
Yes.
we have lactation specialists who are guiding women on putting baby to breast more often than every 2 hours, if that's what it needs to happen, or discouraging formula, letting them know that will diminish their milk supply.
Yes, we have all of us are CLSs, so we're certified lactation specialists, and we actually take a test and everything. We take a boards or a test when we get into WIC, so that actually we're certified by the state there. And then beyond that, though, beyond all of us being either CLCs or CLSs, we have a breastfeeding peer counselor, and we also utilize Allison, who is our IBCLC on staff, or well, she's not really on. She's in the public health department, and we refer out to her. We also have Billy, who is an IBCLC on staff. So we have two IBCLCs, which are board and certified lactation specialists, and then we all have to be certified in lactation in WIC. So yes, very much so. Those are all really, really good questions.
This is Eric. I have a quick question about, do you know about how many like women or infants are in each group as far as the like exclusive breastfeed,
Like
mostly
what is our
breastfeed, some breastfeed?
Yes, I can get you those numbers specifically, Eric, because I do have records on those and I should have put them in here. But I would say right now with breastfeeding, just by going by memory, we do really good in initiation breastfeeding, like getting them to start it, but that duration is where it's hard. Going to 3 months, going to 6 months, going to a year, that's when we see a lot of them fall off. So I can get you those exact numbers because I don't want to speak, with not true data, but kind of, speaking kind of off the cuff within my memory right now, and I should have put it on here. But the initiation is probably around, oh gosh, I would say 70%. And then it kind of drops from there. So
do you know what kind of the major barriers are to kind of continuation of breastfeeding?
Yes, and you're gonna think that I'm crazy, but a major barrier for us is the hospitals. I know that sounds insane, but right away when they're in the hospitals, when they're in the hospital in labor and delivery, there is a small push for formula right away, like, and taking the baby and, clamping the cord right away, taking the baby, weighing, measuring, not letting them have that golden hour. That's a huge barrier. And we've had, we've actually created initiatives around, that particular barrier, which is called co-effective through WIC. And that all has to deal with your experience, being your own advocate at the hospital, that golden hour, the not bathing the baby before the baby gets a chance to breastfeed, not, you know, so all of those levels, so those are huge barriers. And then also, so the hospital can be one barrier, and then also all the barriers that have to do with employment and what our moms right now who are on WIC are doing postpartum. So, you know, if you're a gas station attendant, you're not exactly able to pump every 2 hours. Do you know what I mean? And you're not given any leave, you know, to be able to be off with your baby for a certain amount of time, to be able to have that, you know, 6 months of really exclusive breastfeeding to set that breastfeeding tone for the duration of their experience. So it really has to do with, you know, kind of how culturally we're set up is a lot of these barriers, which, you know, it's hard to fight, obviously.
Mhm.
So.
Well, yeah, thank you. I had some suspicion that, because I mean, I've definitely heard about, like, I mean, that there's a reason why, like, Similac and Infamil, people sample to hospitals, like,
Exactly.
that,
Yes.
that they know their golden hour too, and it's right away. So it's,
Exactly.
so there's that industrial push, but thank you.
Yes, no, that, and you're so right when you say that, because, you know, right away when someone is pregnant, they will get a sample sent to their household. They know who is pregnant in the area. They will get samples sent to their house. And so for a mom who's struggling and it's sitting right there on the counter, or a mom who's struggling and the nurse or whoever who they trust heavily is saying, you know, we can just do this for until you rest, or we can do this until you know, until she latches or whatever. That is a huge barrier. So, all right. Sorry, I'm going to try to keep this very short. Okay. Snapshot of what we look like demographic wise. I don't think it's a big surprise. 2% of us are homeless, 6% of us are Spanish speaking, 94%, Doug, we talked about this the other day, are on Medicaid or Badger Care. So that's a huge percentage, because Badger Care and Medicaid make them adjunctly eligible for WIC. So a lot of the time that's a good joint correlation there, or collaboration, I should say. 30% are between 1 and 100% of the FPL, so the lowest of the low, in far as income is what I'm trying to get after there. 63% of referrals come from a friend or relative. And so it really isn't any marketing that we're doing. It's really generational. And then 40%, 47% have 12 years of education experience. So meaning most of them, almost half, then only have a high school diploma. So, sorry. Excuse me. And here's who we serve. Obviously, we talked about this: pregnant women, breastfeeding women, non-breastfeeding, postpartum women, infants, and toddlers up to the age of 5, sorry. And common locations right now for WIC, we call them suitcase clinics at times too, where we really can do WIC anywhere. County health departments, hospitals, mobile clinics, community health centers, schools. This is all the places around the nation right now that clinics have been done. Public housing sites, migrant sites, Indian health service facilities. So we really can do WIC absolutely anywhere, which is kind of where I hope WIC goes. I hope we get out of one central area, and I hope we flourish, because we've seen that the waivers and everything, that they need us to come to them and to kind of protect the integrity of not becoming, you know, just another food share. Not saying there's anything bad about food share or anything negative about food share, but there was a reason why we see these families and we take their heights and weights and their anthropometrics and things like that. So we're hoping that WIC turns into more of a patient-centered program, where we are where you need us, kind of thing. So. And then who is eligible? As far as Wisconsin goes, you live in Wisconsin, below the 185% of the FPL, which we actually accept a lot higher than food share does. And then you need help in health and nutrition. You have to have a health or nutrition risk to be able to qualify for WIC. And that's something people don't really understand or know, but also being below the 185th percentile makes you at a health risk. So it's kind of a catch-22 there. It's kind of both, you know what I mean? So you qualifying in income will automatically qualify you in health and nutrition, but that's why we do the screenings also. And I do have a short video. I don't know how to get this to work on here with sharing my screen. Maybe it'll work. Ooh. Maybe it'll work for me today.
Jamie, when you hit share screen, there's a little dot on the bottom that says share audio.
Okay. Okay.
Do you?
Okay. I don't even know if it'll do this though, Elena. It's just here. Do I stop sharing and then share audio?
Yeah, stop share, open your link.
Okay. Okay. And then, okay. Is it under more?
No, share screen.
Share screen? Gotcha.
And when you're choosing your screen, the bottom right has a little radio box that says like share audio.
Okay. Full screen theater, multiplayer settings.
Sorry, I'm talking about share through Zoom.
Okay. Hold on. I'm going to see if it first does it.
It's also saying YouTube's not available on your device, so maybe we've got it.
Yeah, did it do it? Did it do it?
It did, but you gotta get the audio up. So on
Okay.
Zoom, not on the YouTube screen.
Oh, not on the YouTube screen. Okay, hold on. If I can be smarter than the screen right now. Okay, I'm gonna exit here. Okay. Share sound.
Yep.
Alrighty. Okay, let's see if I can do this. Oh, do it. Okay. There. Okay, let's see if this does
Any
it.
WIC authorized grocery store
it
in
working?
Wisconsin.
Yeah.
Finding a participating store is easy. Your local WIC office will give you a list of stores in your area. And if you have the Wisconsin MyWIC mobile app, you can quickly search for WIC authorized stores. You can also look for the WIC Accepted Here sign posted at the entrance, usually on the front door or window. Stores may have WIC approved shelf labels to help you find WIC allowed foods faster, but make sure to refer to your WIC shopping guide for food specifics. Remember to bring 3 things when you shop for WIC foods. Your WIC shopping list to show all of your family's WIC foods for the month. The WIC shopping guide to tell you what foods the WIC program approves. Your WIC card to pay at the register. And if you download the Wisconsin MyWIC app, you'll also be able to see your benefit list and check for approved foods. While you shop, look at your shopping list and shopping guide to double-check your choices. You can only buy foods that are approved by WIC and in your current benefits. Take care to check the package size and brand. Those are specified in some food categories. At checkout, tell the cashier you are using your WIC card and ask if you need to separate your groceries. The cashier will tell you when to swipe your WIC card and when to enter your PIN. Swipe your WIC card the same way you would a debit or credit card. Some stores may ask you to swipe your WIC card at the beginning of the transaction before foods are scanned. Always remember to swipe your WIC card before any other forms of payment, such as food share, cash, credit, or debit cards. Some stores print a receipt before completing your purchase, right after you scan your WIC card. This receipt lists which foods will be deducted from your WIC benefits. Always carefully review this receipt before approving the transaction. If you select items that are not WIC approved or not in your benefit package, you can pay for those items with another form of payment or remove the unwanted items from the transaction. Any remaining balance can be paid with cash, food share, or another form of payment accepted by the store. You'll want to keep your receipt to review benefit information and your updated balance. If you're uncertain about shopping with your WIC card, try just buying 1 or 2 foods on your first shopping trip so you can become comfortable with using your card. Thanks for checking out how to check out with WIC. Want to know more? Visit dhs.wisconsin.gov/WIC.
All right, hopefully. All right.
Thanks, Jamie. That was good.
You're welcome.
Very good, yeah.
Okay.
Good job.
A few,
Can I ask you one more question or not?
Yes, please.
Okay. Jamie?
Yes, I think I can hear you here. Okay, yep.
That's a good program, and I love your numbers, and I think we use this at the farmer's market too in the summer a lot, I think, of some of the programs. The question
Yes.
I had would be, I know you said you're calling a lot of people, right?
Yes.
You said that, so I guess I'm looking on the other end, is there some people that we need to reach out to more? I mean, your numbers are great, I know that, but I'm just saying, is there some unfortunate person? They don't have a car, they're really not educated to figure out the computer stuff or the phone, like me, I can't do a lot of that stuff. But the numbers are good. Is there any more people you think we're missing, or is there somebody out there that's unfortunate that had no opportunity? I mean, I keep thinking about that, with the pandemic and everything, there's people that couldn't drive, they couldn't go to get a shot, they couldn't do this. And then, and if they don't reach out to you, really don't hit those people, right? Unless a friend or somebody refers them and that kind of stuff and that.
Yes, you're exactly right. I think where that lies would be with our community partners. And so a lot of our father cars and our, Christine Ann centers, a lot of our referrals come from there. And so those are, kind of, I would say those are the people that, we don't touch as far as I don't know. Those are the people that don't have a computer, don't have a phone. They don't have any way to, talk with us. And so that's where they come in to play with us is we have a good relationship with a lot of our community partners who help us get those referrals to people who can't go online, who can't use the WIC app, who can't, and a lot of people, will come in and apply just on site. And we're close to a lot of the busing, a lot of the bus stops. And so that also helps. But you're right. What do you do when you don't know about all the programs and you don't have a car and you can't get there and through the pandemic and whatnot? So I would say our community partners help out, and then we get a lot of influx. So anybody who is on Medicaid right now, we will get a shot from their HMO, a referral from their HMO to our influx. It's called. It's a program that we have set up through our computer source, and we will get a note that to reach out to them. And so, do I feel that there's anybody that we're not reaching? I'm sure. I'm sure that there's people that we know that are out there that we could do better at reaching. I would say that, right now we have every avenue possible that we can have at our disposal. It's just that, a WIC is going to be changing over the next few years and what that looks like. And I think we can always do better with that. So
It's great, and the only reason I bring a little bit of that up is, with the warming shelter issues that we just had when it was pretty cold out, it seemed to come out that we found out a lot that the people that are working in some of these places that we assume are doing the right job, that what had happened is the people that are very experienced have quit or left and gone. They've hired brand new people, but they have no experience in anything in healthcare or guidance or stuff like that. So I'm just thinking a lot of these partners that you talk about, some of them probably don't know about the program because they just got hired and their education, because we're finding out that with the health department, is that a lot of them don't have that information. They weren't set up for that, and the people they're replacing with had no background on that. So sometimes it might be to reach out again, because you assume the partners are going to send them to, but maybe we're missing an opportunity. That's all I'm saying, is that I'm just finding out that it's not what I thought or what other people thought was going on, and we assumed, and we really need to reach out a little bit more. That's all I'm saying. I just know that, that's why I was asking about that. Because
No,
I know your numbers are great, and
Yep.
but I just don't want to miss that one person that or two people that, they just couldn't because of something. But if we can educate more and get more information out there, and then open some more doors, your numbers will be bigger, but you're doing a great job with them, so we want that. That's what we want. So
Yeah,
this is
no,
my
no, no.
comment. Appreciate it.
Yes, no, that's a very good question and a very good comment. I do agree. I think that there's people that we do not reach. An example is we had a woman come in yesterday and she was looking for W-2 programs. She was looking for all the information she could find because she only had a few minutes, and she didn't have a car and her kids were finally in school, but she has a baby, and somebody just agreed to watch her baby for a few minutes while she tried to figure out all these programs. She just moved here from Chicago. She's trying to have a better life. And she has nothing. She has absolutely nothing. And so she came to she came to public health, which is a good thing we're correlated with public health, but she came to public health because she knew somebody's got to know something. But yeah, she's a great example. She can't get a job without childcare, and she can't get childcare assistance without a job. And so it's one of those things. And so she only knew to just show up to our doorstep. You know what I mean? And so I do think that we can always do better. And there are people that we're missing that really need our assistance. So thank you.
Thank you.
Any other questions for Jamie?
I'll add on a couple of things that might be helpful. So I just want to reiterate that WIC is run through a federal grant, and funds to administer the WIC program come through the state. The vouchers themselves that are given for nutritious foods are a direct benefit to that individual. Those funds do not flow through the health department. Those are redeemed at area vendors, and a big role for WIC is to increase and promote the number of people that accept WIC benefits within the community. In Winnebago County, and I don't have a number that's that's as recent as I would like, but from memory, over $1 million vouchers are redeemed at area grocers in Winnebago County. So there's incentive also for the vendors to participate in the program to help increase their sales. And then we do WIC at the two sites, the two health department locations. That I don't know if that was clear. Even we're talking about are there some other models that might work better in our community or that might help increase enrollment. We've certainly seen now that we've been able to serve people on the phone rather than having them in person. That we've increased caseload, and we hope to maintain that. The feds are proposing a newer hybrid model that will hopefully reduce the number of in-person visits required, yet still keep us connected and still have us see the families more so than we did during the pandemic, because really having that family, in your office, you can provide more support. You can really understand their situation better. So we do want to see them at least periodically. There may be an expansion in age up to age 6 instead of just up to age 5. But the benefits in the past for those older children have been very low, and not a lot of incentive for a family to try to make a trip in just to get those vouchers. So this hybrid model will hopefully help out quite a bit in retainment. There's a lot of turnover in WIC. Now, Jamie said we've got over 2,000 on caseload right now. We probably serve over 4,000 in the year. So there's just a lot of turnover that occurs. I think those are the things I wanted to add.
Do they get a monthly allotment? And then do they have to use that within the month? It doesn't carry over?
Jamie?
Yes, so it's a 3-month period that they get the benefits. So it's a month, they get all what we don't call them commodities anymore, but it's almost like a commodity package. So they get like, so an example, 4 gallons of whole milk, for a 1-year-old. So they would get 4 gallons and then they would get it for a month period from like the 1st to the 31st, depending on the month. And then it would start over. They do not get an overlap. So they don't,
Okay.
so if they don't use 3 gallons out of the 4, it doesn't then, add on to the other 4 and make 7 gallons. Do you know what I mean? So,
Yeah.
and that's what happens with food share. So people do get that confused. Food share does roll over. And so with us, we do not roll over. So they have to utilize it within that month period. And we give 3 months at a time.
It's, Daisy, this is Karen Powers. Does the stuff have to be purchased by the woman herself, or can it be picked up in the store by her partner, her parents, friends? Can anybody go shopping for her?
Yep, they have to be a proxy on their account. But yes, they have to be an authorized person, or what they call a proxy, on their account right away when they become eligible or are certified, is what we call it. So
Okay.
they can, not just anybody can take their card, because that's where fraud becomes a problem. So not just anybody can have their card and have their name on it. So that it has to be a proxy on their account.
Okay.
But yes, what we are trying to get involved with too is Quick Trip, because there's such food insecurity in certain rural areas. Quick Trip has now become one of those vendors that we're trying to get a hold of to put WIC benefits inside of, so that they also become a WIC vendor. It has not happened in the past because they don't feel like they have the right amount of space to hold all that WIC would require them to hold, as far as like they have to have 3 cans of formula on the shelf at all time. They have to have this, you know what I mean, 45 bundles of bananas. So, but they are becoming, I guess, I don't know. Yeah, they're becoming okay with the fact that they might have to do it, and that they would want to do it, become a WIC vendor, because there is benefit to it. So, we're trying to kind of reach out, and not just those main vendors like Walmart and Pick and Save and Piggly Wiggly and things like that, and trying to reach out to the convenience stores, because we all know that in like Milwaukee counties and like where I came from, Washera County, there is no food for miles. And so, when a pandemic happens, they don't have many options. And so we're also looking into delivery and pickup for WIC participants also, which is currently not happening. So that's also a barrier for WIC participants now. So hopefully in the future, we just like we went from WIC checks to e-WIC card, and we kind of have, been progressive that way. Hopefully we're also progressive in some of these other items, like allowing our participants to pick up or have delivery, or, get their food from a convenience store like everybody else.
Quick question again now, because we do EBT at the farmer's market,
Mhm.
and we find in the wintertime, we don't have as many people come and take advantage. In in the summer, you get 5 or 6 pages. We barely get 4 or 5 people. Do you find the same thing here for you? Winter's tougher to sell and do stuff?
Yes. So we only do farmers market checks during the summertime. And so that's only during the summer, and then wintertime, it's the regular food packages for us. So yes, there is, but if you're asking if there's ebbs and flows to who we have as far as enrollment, as far as WIC, yes, that there is that too throughout the year. We find around holidays, people don't utilize us as much, which is funny because you would think they would. But I think people are just busy. And then we find that yeah, during those entry into the summer months, we have a huge boom of people coming on WIC. So,
Okay, thanks.
and I think everybody probably knows why. It's because they can finally, in the years that prior to having these waivers, it was they could get to us. They could walk here, they could bike here, they could do all of that. So, but now, hopefully we start to have those numbers and those spikes and ebbs and flows start to even out a little bit now that we're possibly going to a hybrid model. So,
Wonderful.
Thank you.
Thank you, Jamie.
yeah, it was a pleasure.
And now we'll go back to item 8, ordinance amendment. Sanitary fee chart.
Yep, so you have there's an agenda item report that was sent with the agenda and a fee schedule, a draft fee schedule, which is really chapter 11, and sets that large sheet that you have in your hands right now. Was also sent electronically. And then also there's a fee comparison document that was sent electronically. Every year we review our sanitarian program. The sanitarian program license, over 1,000 facilities, lodging establishments, food establishments, swimming pools, campgrounds, you name it. You can see on the list in front of you all the different types of establishments that we license. So Ann's team reaches all of those facilities a minimum of once a year. And we estimate our revenue from the number of license holders and what that current fee is. And there's that fee is made up of a local fee that we charge that also has a state fee added into it for what is the total fee. And you can see that total fee on the spreadsheet. The state sets a license amount for the programs that they provide services to, and they charge a percentage of whatever that rate is to all of the local health departments that are considered agents and actually do the inspections as an agent of the state. So we are agents of the state essentially. If we didn't inspect these facilities, the state would send somebody to inspect them. It's beneficial for us to have our inspectors here locally. One, we can assure that they actually do get inspected once a year. We have local knowledge. We can provide support for license holders within the community, and we could be much more responsive to illness outbreaks or any other situations that might occur, power outages, things like that, just try to make sure that the food supply is safe. And the past couple of years, primarily due to COVID, we have not increased fees at all. We usually look at them every year and increase them. We've held them flat. We've also had some turnover in the sanitarian program. So we recalculated our fees and projected our costs over the next year because the license year starts July 1 and goes to the following June 30. We projected what our labor and supply, training costs, that sort of thing, we're going to be over that next year, and compared that to the revenues that we were anticipating receiving. And based on that, we're recommending a 2.5% increase in fees. Considering inflation's 6+%, we haven't raised fees at all in the 2 previous cycles. It was the minimum that we could get away with to help assure that we're at least covering our costs. The state has a requirement or a provision that you cannot charge more than 15% of what the program costs are for administration. And so when we calculate our costs, it's really just staff time. There's no indirect in there. There's not, like one of my times in there. And so there is an administrative cost to the program that's not reflected in that initial calculation. We try to stay in that 0 to 15% to cover that. With the 2.5% increase, you can see that we're just several thousand, I think the revenues are 400 and I don't have it in front of me. They're 400 something that we anticipate to collect. And, it's maybe only 10,000 more that we're actually going to collect beyond that for all of the administrative fees to support the program. So what I'm asking for today is a motion to approve the updated fee schedule. This is an ordinance amendment. It's the chapter A appendix to chapter 11, appendix A to chapter 11 in the county code. And I'll answer any questions that you might have about that.
I'll move that.
Sorry.
Any discussion?
The question, and again, maybe I read it wrong. It was 2.5% and then another 2.5 for administrative. So you're looking for 5?
No, sorry, I wasn't clear about that. It's confusing when you've got a local fee increase and a state fee increase, especially at the same time. The state is increasing their fees this year, this next license year, probably the year after as well. And so we actually have, there's a fee increase there that you can see the percent on the right-hand side there. You can see what the percent fee increase is. We are recommending a 2.5% increase in our fees. There's a increase from 10% to 11% on the state, which is a small, I mean, 10 to 11% is a small amount. It's an increase in 10% on their end, but that adds, roughly, 0.3 to 0.5% to that 2.5. And so you'll see that most of the fees are going up a little less than 3% total. So 2.5% from us, a little bit of an increase because of the state fee. And then we'll have, you see that total fee, and we calculated out the total fee and that percent of fee increase. So you could see the true impact of that.
So it's 2.5, not 5, right?
It's right. It's
2.5
So
plus the state's
right. And so so the total revenues collected will increase by 2.5% to support the cost of running the program. 2.5% plus a very small amount for the additional state fee that goes back to the state.
Yeah, I did, I must be right, because I saw the 2.5, and then after it says all, plus an additional 2.5 administrative costs. So I thought it was 5.
Yeah,
Okay.
No,
That's right. Okay. And you could go up to 15%.
yes, and I think I may have written that wrong. Yep. Yeah. So we try to show you all the math.
Okay, and then just,
I know it gets complicated. You can see what the salaries are for staff.
Yeah.
Approximately 80% on average of the environmental health staff time goes to our agent contract duties. The other 20% of our time in environmental health goes to other environmental health issues, air quality, water quality, toxics, lead, all kinds of other things.
Prior to COVID, how often did we increase fees? What is the expectation of the establishments?
Annually, we review the fees annually and make a recommendation on fee increases. Sometimes it's very small or none. Sometimes, it's a little larger if we're doing an adjustment. So in addition to reviewing the staff changes make a difference. Sometimes we save money when we have a new staff person. That's part of what's happening here is that we have a brand new sanitarian. Our labor and benefit costs went down to run the program. And that's why even after having no increase after 2 years, we're just recommending a 2.5% increase for next year. We do our best to try to keep the fees at the low end of what's allowable, just keep those costs down for our operators. And so we look at it annually and we generally make a recommendation to adjust them annually.
in the last 2 years, we didn't increase it, right?
Correct.
So that, how did that affect us? Because the cost of it, so that we have to go up to it.
Yeah, I did, I purposely didn't take a look at losses.
Okay.
And project those forward. Partly, because I don't think we had staff turnover. We had a very short period of time during the pandemic where we had to suspend operations, although unlike most jurisdictions that stopped doing inspections, we just kept doing them right through the pandemic. And so we did have, we probably did okay. I didn't really go back and look.
Yeah, because that one there, it said, we've been able to keep it down because of turnover. Because we lost people that we need people, to keep our
We
quality
do.
up. So I don't want to benefit because someone left, that's what I was thinking about when I saw that. Okay. And that makes sense. I mean, I just came back from a conference in NACO and they talked about a lot of stuff, but the thing that's interesting is like, and I've been reading a couple of books about, are we doing everything we can? Are we getting the money out of the best things? Are we getting the money out of the best ones? You're increasing across the board. Is there other areas that we need to, that we are probably not? I mean, that's why I look at it a lot of times now, is that I know you do this because this, but the last 2 years, you said you've been able to get along, but when you take 1% from the state, 2.5%, that's 3.5% people are going to pay fees, they're going to pay.
I'm sorry.
All of the email.
No, I can just folder.
Okay.
With all of the files are in the Board of Health folder and 23 for this meeting. I just know there's people online. I didn't wanted to make sure they could see what we had.
So this is, Eric Swanlick. I saw that there's a number of the things, like the inspections were related to like special events, like special event campgrounds and stuff like that, which, like obviously with sort of Country USA, Rock USA, some of those things going away, is there less need for inspection now than there was pre-pandemic, or is it kind of leveled off?
Country USA and Rock USA were only one special event campground,
Okay,
so we only really lost one. The majority is EAA.
okay,
So it's the EA grounds and then the houses that all have the campers and, you know, all the trailers in their front yards. So those are special event
Yeah,
campgrounds.
we didn't really see a reduction in the number of licenses during the pandemic. I mean, you heard about restaurants shutting down, but there were others that were opening. We have more now than we had pre-pandemic. So,
okay, so,
yeah.
I was just curious, yeah, 'cause you hear about all that stuff where, what was that loss from the
Yeah.
pandemic, and I mean, obviously, there's the big picture ones that we see here, but it sounds like that didn't make much difference.
Yeah, businesses that were barely hanging on or weren't able to adapt, to, different types of service delivery or couldn't bring in staff. I mean, we definitely saw some closings, but we really did see some establishments do really well and a number of new ones open.
Yeah, well, I mean, obviously, like, we have new hotels and stuff like that, that would make sense, so.
Doug, if you look over the past 10 years, is 2.5% higher or lower than what we've typically had to raise fees?
I was thinking back to all of the increases we've done, 2 to 3% is pretty typical.
So it's pretty much in line with what
Yeah.
historically you've done.
So if we look at the chart, 1, 2, 3, 4, the fifth column, is that the price that it would be, and the eighth column is the price that it is?
So the total, the column total fees, same,
Yes.
right there. That's the fee to the establishment. Of that 200, so that first fee, that prepackaged GTS foods, $209 is the fee to the establishment. What's that? The proposed fee.
Okay,
Yeah.
and what they
The
are,
new proposed fee.
and what they are paying is the 203.
Yes, that was
Okay.
that was the old fee. Yep.
So
And then-
even, sorry.
Yep, and that's so, and then so 200, and we do a rounding rather than have, just to make it easy for the math and writing the checks. And so then you can see that total, after the total fee, there's a 20% increase for 23-24. So you can see that the prepackaged DCS food with the rounding is a 3% increase. 0.5% of that 3% is because of the state fee. It's not an additional on top of the 3.
For most of these places, you're talking an $11 difference. I mean, it's not that, 2.5% isn't that much.
And that's yearly,
That's in hand, yeah.
annual, okay, so yeah, for like a big hotel, it's $18 a year.
Yeah, so 250, so that fee went up $6, from 3 years ago.
And every year, Tom Egan, who's no longer part of this, talks about the nonprofits, but I don't see that on here this year.
Nonprofits should be on here.
Sorry. We have a transient retail food processing.
Oh, fancy words.
Nonprofit and a nonprofit, yeah.
Oh, I see,
Oh, there
thank
it is.
you. Okay.
So we are the only county that has a nonprofit transient retail food fee. All
I'm okay with
nonprofits,
that, I just know
all
that.
nonprofits in other counties pay the.
The full fee.
Okay.
Do you have much problem with establishments that just won't pay, or you have to charge them late fees or
I
anything
think
like
we had
that?
about 20 late fees last year that people ended up paying, and it's the same people over and over. It's just the way they do business.
Pretty much expected.
Just, yeah, we can guess which ones are gonna be late every year.
And there is a late fee too.
Yeah.
It's $157.
How much is it like?
$157. That's just the way they do business.
Yeah, I mean, that's crazy. Maybe they need the money.
I guess they wanna give us extra money.
Exactly.
It's scroll to the
But they
bottom.
like this so much, they want to give us.
Did you scroll to the bottom, the document? there's some totals down there that are helpful. So you can see there's, we estimate licensing 1,281 establishments. So that's, 4 staff getting out to all those events. The estimated reimbursement to the state of the total revenues we collect is a little over 30,697. And then if you scroll up again, all the way up, there you go. You can see that the total estimated revenue based on the number of licenses that we expect to have during the license period times the new license fee is at $418,000. We estimate our total expenses at $407,814. And so we're shooting for between 0 and 15%. The max we'd want to collect is $468,986. What we're proposing to collect is the 418. So 407 to 418, roughly $10,000 to support all of the administrative costs, well below the 468 that is allowable.
And that'll cover like the people we lost. Like I said, there was turnover, but now we're gonna need more people to cover something
Yeah,
else.
and we
that'll be enough
hired.
to-
Yep, we're
Take care
fully
of that.
staffed and we're using the estimates based on the current staffing. I mean, we can only, it's all we, I mean, that's all we can do. I mean, if we have turnover and our costs change, they'll change. Well, we try to forecast the best we can. Like I said, based on 80% of staff, there's mileage costs, there's equipment costs that are changing. And we try to factor as much of that as we can in. And then add a little bit more for, we've got time in our accounting associate, support staff time, sending out licenses, my time meeting with the age staff or, working on outbreaks or whatever it might be.
If no more questions, I think we already motioned it, so we can vote on it.
Yep, you motioned in second, I believe, already.
Yeah.
Or-
So any other, I'm sorry?
Nothing.
Are these-
Going through, making sure I get my stuff written down correctly.
All those in favor, say aye.
Aye.
Those not in favor? That'll pass.
Thank you. This will now go to the county board meeting. It doesn't make you stop at the end because it's an ordinance amendment. So one of the, we are working, as you can see on the agenda today, we have some ordinance amendments. One of the considerations moving forward is should these annual fees be a part of ordinance? We have other fees in the department. What we charge for immunizations and TB skin tests or radon kits or, other things that we provide services for. There is no, we have a fee schedule, we update it every year. It's what we charge for those services, but they're not in actual ordinance. And so something for you to think about is, is this a process that we want to continue as an annual approval by the Board of Health and the county board? Or is that something that we just bring annually as an update for discussion, to you? I only bring that up because time, we start this process, it's February, the fees don't start until July. It takes time to assemble this, which is we do every year anyway, but it has to go to the county board. And it doesn't always, there may be something that doesn't pass. If something doesn't pass here, you want us to make an adjustment to this. We've got to make that adjustment, bring it back. It's got to go to county board. If county board doesn't approve, then we've got to make an adjustment and bring it back. We need to have our fees established by the middle of May, well, before the middle of May, so that we can actually send out the licensing so that people can have an opportunity to return that before the license period starts on July 1st. So just something I'll probably bring up later for consideration. This is the way we've been doing it.
Good, because that's, again, when we go, that's the thing we come up with is people ask questions, why are we doing this? The only thing I had was the question, it seemed like a bigger increase, but you explained it to me, so. Cool.
Next item, the budget transfer.
Yep, in your packets was a budget transfer of $100,000 from the new mental health connection to support one of our current positions, a suicide prevention project coordinator. This is basically just a shift in a revenue source. We were receiving funds from Samaritan Counseling and from a federal grant, excuse me, not federal grant, Advancing Healthier Wisconsin, a medical college grant that we have with New Mental Health Connection to support this position. And what we learned after we did budget was that the funds for this position were going to get shifted from Samaritan, who was providing most of the funding for that position, to New Mental Health Connection that acquired different funds. And so really, there's very little impact on our total budget with this. Bringing in a new revenue source, and then we'll be deleting a different revenue source that isn't coming in. If that makes sense. And the 100,000 is enough to cover the position plus benefits.
For a year.
Yeah, for the calendar year.
And what happens after that?
So we'll either, as we start working on budget later in the year, we'll check back in with New Mental Health Connection and see if they have funds to continue to support it. If they don't, then, you know, this position might have something. Sure. So this was a position that was created because of grant funding, a multi-year grant that we are the fiscal agent for with New Mental Health Connection. And when those grant funds, you know, stop flowing, we won't be able to continue that position. Generally, we have enough knowledge to, you know, let the person know. Other funding sources may come up. This is important work. I had a feeling that we'll continue to see funding for it, but that's a process we have to look at every year.
This is about suicide, right?
Mm-hmm.
So it's not, it's going higher now, it's not going lower, so this is something future wise has to stay, or has to be here, or somehow we have to make sure we get funds for
We'd still like to continue the work. You know, this is a New Mental Health Connection is a tri-county initiative. But it's all grant funded. There's no levy in this, so.
So just to be clear, the request is just to accept the funds, is that?
The request is to accept the funds, right? And by doing a budget transfer or having that budget transfer approved, we get to actually bring the funds into the budget so that we can expense them out. If we don't bring them into the budget, then technically can't spend those dollars.
Is the person, are they an employee of the health department, or are they being contracted?
They're an employee.
Okay. And so even though it's a tri-county initiative, are they just doing work in?
No, they're working with New Mental Health Connection, so they really serve the tri-county area. We're the fiscal agent for the grant. And so we support New Mental Health Connection by being that fiscal agent, managing the grant funds, assuring them, the reports get in, meeting the grant objectives. Much of that, of course, is done by New Mental Health Connection. They're just not in a position or have a structure in which they can, manage and have a large grant audited. They don't have an HR component to their 501c3, their organization. So we take on that load and be that fiscal agent so they can just focus on the work. And it's not uncommon that we act as fiscal agents for some of our non-governmental organizations so they can do the work. Because if they don't have the infrastructure to meet the audit requirements or have things in place to manage employees and benefits, it's really tough for them to run those. So for this, I would be looking for a motion to approve the $100,000 budget transfer.
I move the motion to approve it.
I'll second it.
All those in favor say aye.
Aye.
All those not in favor. So that passes.
Thank you.
So then the ordinance amendment, chapter 11, add a section on childhood lead poisoning.
So in your packets, there are, two potential ordinance amendments, and I put them on the agenda for discussion. So that you would have an opportunity to look at it, for us to discuss today, for you to come back with any comments or suggestions you might have, also to give, the public a chance to see the language, and look at it, provide feedback before we propose, a final draft for moving to the county board. And we're interested in adding a section on childhood lead poisoning for a few reasons. One is we have expanded our lead poisoning prevention program. We have a new position that's funded with funds from the city of Oshkosh, CDBG funds, from the state lead hazard program, and also from HUD. And those funds, those three funding sources support a full-time position to recruit contractors, to do lead inspections, homes of lead poisoned children, and help fund lead abatement. As such, we'll be much more active in working with contractors, and there'll be many more lead abatement types of projects going on within our community. One of the things we don't have in our current language that's in state statute, are references to the childhood lead poisoning statutes and codes. By bringing that language into our local code, it's not buried in the state code someplace. It's very clear what the requirements are and what the authority of the health department is in that. It also provides a mechanism for if there needs to be enforcement. Say someone is, grinding lead paint, and that, because they received orders, creating a lead hazard, or they're doing improper lead abatement in a home where there's orders, and that, is exposing a child to even more lead, and, trying to help out. I don't, maybe other situations where improper lead abatement may be conducted or being conducted, without any kind of license or permit. There's no additional language here that isn't already in state code, but it does give us the opportunity to, if we need to write citation, to write it locally and have our council process it, as opposed to writing it on state code and having it go through the DA's office. The language here also helps support our local jurisdictions, the towns that have no language related to lead. And they can certainly reference, the county code if they want to, but it provides just a very clear way for us to manage projects that are occurring in the county and be, hopefully a little more responsive to the council, and also providing the opportunity much quicker for someone that wants to contest a violation to be able to do so. And so, so right now it's just a document for, for your review and reflection. I am interested in hearing back from you about any concerns you have about adding to ordinance. Any things that you want to be assured are addressed. We're happy to tweak this and adjust it, based on the feedback that we get. Ann, you want to add anything? Yeah.
So the wording of the ordinance is pulled from the state, right? So
Much of it is just much of it's state language, yeah. So, and we reference chapter 251, and so that's the second one, yeah. So we're not talking about that one yet. Well,
This one,
we're not talking about this one.
not this one.
No, just the lead one right now. No,
I don't have the lead one.
no,
What is it called in that folder?
it is called.
Lead poisoning exposure ordinance draft, that one.
Yeah. So we reference 254 is the environmental health chapter in the state budget. Lead poisoning has sections underneath that. And what I also want to do is, I'm trying to get, I want to have feedback from you on this, because we haven't taken this to Corp Council yet. What we wanted to do is have a discussion, propose the language, then take it to Corp Council, so they can tweak it to fit, our code of ordinances, and also to really review the whole process of the enforcement part. That's the weakest part of all of this for us is the enforcement part. We just want to make sure that it's written in a way that, you know, if we need to, we have to have enforcement, that we have it clearly stated in the language and the process clearly stated, not only for how that gets processed, but also how it can be appealed.
And it needs to be approved by the board because it's an ordinance, because we don't approve everything, right?
Right.
But it's an ordinance.
It's a change
so-
to the ordinance, yeah.
Okay.
And it- just like what we talked about with the sanitary piece, it's in the ordinance, it has to be approved by the county board.
And I read through it and it all is, it makes sense. The only one that I see from what had happened in the past is that enforcement is gonna be wrestled with a lot, you know, right? I mean, because you know that from 11, I think it's 11.08 or whatever, the other one, that's all I heard when I was running. I was the one that they were nothing against you.
No,
Okay,
and we
but then they were
understand
giving you so much power and everybody said, why are we doing that? Why are we giving one person the power to do all this? And again, when you read it, a person on the streets read it, it's gonna think, well, now we're giving them some more. I mean, that's what I would think. The rest all makes sense because you're protecting us, you're doing that. But to me, that's probably what we're gonna hear a lot about.
Yeah.
I could be wrong, you know, but I swear that's where it is.
No, I appreciate that. We had a discussion about that too. Just so for clarity, there is nothing proposed here that adds power, you know, to the health department. This is all already in state statute. It does make it very clear though, locally, what's required. You know, we want the people that are doing lead abatement, the families that have or owners of homes that are gonna do lead abatement to be really clear, and have that local source of information. We don't typically like to be redundant for state code as state code changes, but it just makes sense in some situations to bring these language together in one place. Just have, you know, a chapter on lead poisoning that the community can reference.
So how unique is Winnebago County from the state, right? I mean, how, if we bring this into local ordinance, then we're responsible for them keeping it up to date and being attuned to the needs of Winnebago County, which is great. But is that how unique there's a cost and an administration to pulling that into the county level?
Most,
So how unique are we that we need to manage it versus the state?
yeah, most counties our size and larger and even smaller than us have language like this in local ordinance for health. Our code of ordinances for health are small compared to most other communities our size. We, you know, relied mostly on referencing state statute. That's been an attitude of our previous corp council. And with the new corp council and discussions we've had with them, and now the increase in activity, you know, we really thought it was a good time to bring the language in. So yeah, there is, you know, a maintenance factor. We'll have to, you know, update it periodically as we do. And right now the county is going through a whole code codification process. So they're updating the entire county code, something that hasn't been done in, you know, over 20 years.
Is this state statute pretty stable as far as has lead changed much in the last
It's
5 to
changed.
10 years? The state statute would change and then we'd have to come back to this.
No, I mean, I would say, you know, in the last 10 to 15 years, the only things that I can think of that have changed is some of the language around certifications, the type, you know, what a lead risk assessor is, or what a lead hazard investigation is, what clearance level is considered to be when you have to, after the job's over. Those have been the bigger changes, and most of those were quite a while ago.
Into the definition.
Mhm. Yeah, CDC is, you know, is lowering the threshold of what they, you know, consider an elevated blood level. And that's just because we've gotten better at eliminating lead. You know, we didn't, you know, I worked in Milwaukee prior to coming here, and I mean, we didn't go out on a lead investigation unless it was 20 or higher, you know, and 45 kids were in the hospital being chelated. And we couldn't keep up. You know, now, you know, our average lead levels are significantly lower. We've done a really good job of educating, eliminating a lot of the hazards. And are now looking at more of the secondary sources in addition to lead paint. Lead paint is still the #1 source of lead for poisoning, but, you know, I mean, leaded gas back in the 70s, we got rid of, but now, you know, we're looking at lead in water, we're looking at lead in other products. And we'll continue, you know, down that path, trying to lower that.
Maybe beyond your level of expertise. Why is there lead-based paint? What's the advantage to having lead in your paint? It sounds scary. At the time they started making paint, maybe didn't sound scary. So what does lead do to paint?
Yeah, no, that's a good question. I could try to answer that, but I mean, from what you know, leaded paint lasts a long time. It was, you know, it was used, I can't remember when they started using it. I mean, turn of the century type stuff.
Yeah.
And really right through the 1940s, it was used very heavily. You know, once the hazards were made obvious and those older homes started deteriorating, we started to see, you know, lead levels from paint go up. But that paint's very heavy. The rain will actually help, you know, wash and keep it clean. I'm trying to remember the technical term for the paint. You know,
That rain's outdoors. The lead-based paint is a problem indoors.
and outdoors.
Oh, is it? Oh, okay. Because it runs into the groundwater?
No, it contaminates the soil. It can be trapped in the house. Kids might play, you know, there, you know, so the drip lines of the house have a lot of lead. The highest, so exterior paint and then interior semi-gloss and gloss paints have the highest amount of lead in them. And then some varnishes and other products have lead in them too. And it was used because it really was a high quality product. We saw it, you see it used on a lot of exterior structures, bridges. So lead paint's been used there for a long time and still continues to be used in some instances. But, you know, taking that lead down, you know, those are really big projects. You see them wrap up the entire bridge in plastic and, you know, take that lead off. So, but yeah, just really high quality paint.
Okay.
Lasts a long time.
Getting back to the ordinance too, isn't it just more efficient to have this done locally rather than wait for the state to come in? I mean, if there's an issue identified, you could be out there that day or the day after. If you call the state to come in, maybe we'll see them next week. Probably the week after that.
Yeah.
You know, and just to handle it locally and, you know, take care of our own stuff right here.
Yeah, and I mean, we can handle it locally now. It's just not, it's much less efficient to run it through the district attorney's office than it is to run it through municipal court.
Is there any advantage to the person who may be offending to go to municipal court versus going to?
Faster.
That would be a faster resolution. So if you
Especially if they didn't agree, right?
you get your hand slapped quicker.
Well, that or you get an opportunity to split your case quicker.
Yeah.
We write very few citations. I mean, I don't know.
I haven't heard one here yet.
I mean, I'm sure it's been less than a handful all the time I've been here. You know, that's not how we attack this. But with lead, with something with lead, you know, I mean, if somebody's got a lead poisoned child in the home, there's orders, it's gonna cost $15,000 to fix it. You know, the property owner knows that these orders are coming. You know, there's been plenty of cases where somebody just goes in and tries to fix it themselves before they get the orders, and then they've created lead contamination all over the place, or poisoned additional kids, or made another kid worse. So we want the abatement of lead to be done by certified trained people and to be used and done with proper methods. You make a bad situation a lot worse very quickly, you know.
Okay, if we go back to now, like you said, you haven't written any citations, as long as you remember, right? So would you say in a year's time? How many complaints do we get?
This is a newer program.
We never had any of these before.
You know, we've had orders outstanding on a number of properties. Those are required to have, lead trained personnel do it. Now we've brought money in to help actually pay to have that work done. So we're bringing in contractors that have never worked with us before, maybe haven't worked in this area. They're newly trained in lead. And so we want to monitor those jobs, assure that those lead safe methods are being used. And then if somebody is, trying to eliminate lead hazards in an unsafe way, either because they think it's going to save themselves money or they, don't want to bother with lead safe methods, we have a method to stop that.
So it's kind of a newer program. We don't really know how it's gonna be, right?
Newer in that we're able to help property owners pay for it. And in the past, if somebody couldn't pay for it, the house just sat.
So was it an issue more so in the past that couldn't afford to fix it, so not all was really done, so right? But now it's coming to the forefront where now there's gonna be consultants.
Yeah, the whole goal of this program is just to create additional lead safe housing in the community. Lead poisoning kids are a priority. We want to react to those, but anyone that is willing to rent the families with kids that wants to reduce the lead burden in their home can apply with us to be part of this program, and we'll pay a significant portion of the abatement.
Well, to me, it would seem like this is one we're gonna have to educate upfront before. I mean, when you put the ordinance out, why you're doing it, we haven't had this problem before, but educate them. There's a program now where it's gonna be paid for, help for. If you get that out front, it's probably easier to sell. I think, I mean, then, okay, here's what we're doing, why are we doing it, that kind of stuff. Yeah. People look at all that, but they will go to enforcement. I just know what people have talked to in that. But if they have the education, the program is good. We didn't really have a problem, but we couldn't afford to pay for it. You couldn't afford to pay for it. There's opportunities. If we educate up front, I think that some, this would be easier to promote, I think. What I'm thinking, because now, again, I didn't know. I always thought this was a problem. That's why we're doing it, but now it wasn't really, except people couldn't afford to pay for it. So what kind of, people got sick, things happen, and now there's opportunity, which is good. It's the positive side, so. Right?
Well, the program exists regardless of this ordinance or not, though, right?
It does, and we're actually, trying to be a little responsive to what we know is gonna be an increase in activity and abatement jobs occurring. It's the volume of work will be higher as we can pull more funds into the community. So we're pulling federal funds, we're pulling state funds, some local funds to administer the program, and then we're getting funds from HUD and the state to actually pay for the abatements. And these jobs are tens of thousands of dollars, and so we're being able to improve properties, make more lead safe houses, but we also, because of the attraction of that, we may become aware of more lead hazard situations than we were before. And we go, if we go respond to a complaint about a lead hazard, that may generate more activity or orders to the correct conditions, and that could also generate activity that's not done properly.
But I think this ordinance is very important too, because, it's not just that you want to go out there and bring down the hammer on people. It's you want to be aware of these things, so you can educate, you can make them, help them to take advantage of these programs. I think that's a real big misconception, going back a couple of years on the county board, that they don't want to give one person all this power, and that's really not what it's about. It's
We bend over backwards to
Yeah,
help people and, educate them.
right. I think
This
it's
is-
irresponsible not to have
That's
something
doing
like
it.
this.
So, what we could do is, we could schedule a special orders meeting to just talk about the lead program, what's new with it, what the opportunities are, present this ordinance language as a part of that, before asking, for to vote on it.
I think that would be good. I mean, especially because I mean, I think really the web program is designed to help both homeowners and larger property owners too, to say, hey, if you're interested in improving your properties and you have older housing stock, this is an excellent way to do it.
Yeah.
And what we're really trying to do here is protect others from, if a contractor saying, hey, I went through all the stuff to get to be a certified elevator, you should be using those folks versus some other person who didn't go through this, right?
That's the weakest link in our program right now is having enough certified staff and contractors to do the work. And it's driving the cost of those jobs very high because there's not a lot of competition right now.
But I'm gonna ask again, because I'm still trying to figure this out. Does this ordinance prevent this from, is this not having this ordinance a barrier to that problem? Or is that a problem regardless?
No, it'll, this ordinance, well, one, it's two things. We've not had, the corporate council that was very supportive of, bringing in additional language, that corporate council would have to support, if there were violations in the past, and, we're having, this growth and work in this area that we want to make sure that we're very clear that it's very serious, and we want only certified contractors to be doing the work. And that there's a penalty for not following those rules. It's just, it's a combination. Really, it's, it's just kind of a natural evolution of language because of the additional funds that are coming in to do this work. I mean, we don't have to pass this ordinance. It would definitely slow down enforcement activity if we needed to do it. And we'd be referencing state language in any communication that we had to public contractors and property owners.
If you didn't have these funds coming in, what would happen?
If we didn't have the abatement funds
If you
coming
didn't
in,
have it, what would happen?
this might be part of, we've been looking to add sections on human health hazards for some time. That is really a part of a human health hazard, but because of how much language there is in state statute and it's treated really separately, we're just bringing it to you as a part of a more comprehensive human health hazard ordinance.
Do you have any say community input, like where you would have a community meeting where you bring out this program's now what's going to happen before it comes out, or do you get some input from people? Open meetings and type things. I know the board, but I mean about people in the public.
Yeah, so I mean, that's part of
Explain the program.
Yeah, that's really part of the reason I brought your discussion today, before, bringing it to you for any kind of approval, was to get some feedback from you. We have a very small contractor base right now. We're working on it. We certainly can do a special orders meeting to draw additional attention to the benefit of the funding that's available. And also, and introduce this language. And really, this, it does draw attention to it, which is good.
Yeah.
But it just it doesn't change our enforcement or ability to do enforcement. It just changes the process for it.
I still think if more people are educated with that, the enforcement isn't as important. This by itself, take the trees, that's all thing. And the last question I asked so many now, but you have people that are going to be able to do this. What safety do we have to know that there isn't people doing it wrong? What netting do you have for that end?
So, increasing awareness, hopefully the community is more aware that, if somebody is deciding to take the lead off their house, that, it should be done in a safe way, and ideally by a certified contractor. The jobs that are done, we know when those jobs will be done. We would routinely inspect jobs that are in process, so that we can assure that those are being done safely. We conduct a clearance sampling at the end of those jobs to make sure that there's no residual lead left, that it is properly cleaned. And then if there's jobs that are occurring in the community, unless we happen to stumble across it or somebody calls it in, we would know about it.
So like if you have these, people that do it, and it's very expensive, you said. Okay, so I got lived in my house and you told me about it, but I got my cousin Joe that does it on the side. He'll do it for 1/3 of all that, you know? And they'll do it, they did their job, but we don't know if they did qualify like these other guys. And plus now you'll be referring county where we use these funds to help these selected number. Not everybody, just the selected because they're trained, right? That's kind of, we're gonna be sending them to those people.
Yeah, part of the funding is we're paying for training.
Okay.
So we have funds available to train the current contractors that are here. We're even paying them to go to the class, giving them, a stipend to go and pay for the training so that we can really increase the number of available contractors here.
So, discussion, my advice, going through the whole COVID thing, there's a difference between, I'm all in favor of doing everything we can to protect the public from COVID. I'm sorry, lead daters. But I think what you're asking here, there's the health piece and there's the purely political piece. And I think we're gonna get spun up, even just based on all of our questions, right? So it's gonna be spinning again with a lot of confusion of if this is gonna give us a better program versus do we have a program today? You know what I'm saying? We really have to differentiate, well, what this ordinance really, what difference this ordinance will make versus what we have today. But first, you probably just have to just explain what we do today. And then what this ordinance will do to change or look like that. Because we're all asking questions about this is gonna give us more funding, this is gonna give us a program, this is gonna give us rules. We have all that today.
Right, yeah, it's not gonna attract more funding. So I understand.
Yeah.
And it'll be good for us to think further about, which is why we brought it here for discussion.
It sounds like the difference is this something that we can address locally versus is this something that we need to send from Madison to the state to have?
Yeah.
So that's the downside of not doing it is, well, then other people that you may not like would take care of it. From a political standpoint. Evers.
Full chart when you present it to the board and say like, this is what we're doing now. You go here, here, here. This is what we want to do here, here, here. Right, because that's really the difference is you are making it efficient. And I think a picture and maybe timing, like you have to go here, it takes a week. We have to go here, it takes a week. By the time it comes back to us, it's 3 weeks. And we want to go here, 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 and it takes 3 days.
So the health department is only involved in lead removal or some sort of mitigation if the homeowner, if the building owner wants to remove lead. But we don't do anything about investigating older buildings that are regularly used by people every day or several times a week. That may or may not have lead. We don't do anything to look for it.
Only, yeah, it is a passive program. We receive reports of lead poison kids.
That's how
And
you first find out.
that's how we typically find out. And then if we know there's a lead poison child, we'll evaluate the environment that child spends time in, try to see if we can figure out what the source of the lead is.
Okay.
If it's the housing, there's lead-based paint presence, it's deteriorating, those are the times where we're gonna issue an order. And that's what we've done all along. If somebody were to call us and say, hey, there's somebody's, grinding all the paint off their house and it's lead-based paint, that's something we also respond to in the past. Right, and say, no, you can't grind the paint off the house if it's lead, or, have you had it tested? Do you know if it's lead or not? What's different now is, is we've been able to bring in funding to help actually pay for the remediation. And it doesn't have to be in a house where there's a lead poisoned child. It just has to be an environment where there's lead that is accessible to children. And there's funding from the state and feds that it can help us pay for it, so we can increase the amount of lead safe housing stock in our community. Have additional places for our
Tie up that dog.
additional places for our families with children to live in, lead safe environments.
Okay,
So I mean, hundreds of thousands of dollars coming in to help pay to improve properties is the only thing that's really changed.
And I think, for the most part, the enrollment would be voluntary unless
It is.
in that rare case where. I think probably the vast majority of the orders that are made are related to kids, the children that potentially.
And even those are eligible for funding. So as if we have a lead poisoned child, we get a report. We are required we're required by state statute to do an investigation of that. If there are lead hazards present, we would issue orders. The property owner, either the owner occupant or the landlord, at that point would have the opportunity to, correct those conditions. Enroll in a program and help us, let us help pay for those conditions, or refuse to do it entirely. And if there are lead hazards present, then we would deem that property not habitable until those conditions were corrected.
And it's just that currently, you can go out and do those orders because of what's written in the state statutes. And I just want to bring that down to put it into local ordinance to make it very clear. So, it's too bad that we're kind of tied to using that word enforcement, because that has a connotation with it. It's really enforcement and facilitation, to help improve the quality of the environment, get rid of those hazards, even help people pay for it now.
Well, and it sounds like it's, if you had cousin John, who knows how to do this stuff, like, there's even an opportunity for him to get educated and say, hey, if you'd like to, if you like to strip paint and do that stuff, hey, I'll let a bidder and hey, you can make a couple more bucks, do it.
Right.
See, those are the points you gotta get out. You gotta get out that, not just the 3 or 4 you have now. Anyone that does that business can get trained if they want to do that. It'll help them business that. I just feel the beginning is the more you put the positive spin on this, the better. Because I think even when I was reading through it, there was one time, and I meant by the other one that you have through, but it was like you can go through someone's apartment at a convenient time with them and that. So, all that stuff sounds a little, I hate to use that word enforcement, but
Right.
like you're gonna start going from house to house looking for this. That's the first thing. I mean,
That's what
that's
they'll
the
say
first thing.
based on.
That's why, and then we didn't have a problem with this before. Why are you all of a sudden proposing this? You got some funds, you're gonna come to our house and start knocking. I mean,
Yeah.
I just, from what I know about people so far, there is a reason. They're not looking like you're helping, but if they explain that you got these grants, they're being trained to that. So we're gonna take care of an issue that's out there. Well, then, I guess that it's not as bad. That's
And
all I'm
also,
saying, but-
Doug can go out into people's houses right now,
Yeah.
under the state statute.
But you are, right?
It's not
Really,
happening. That's not
only
gonna
if we-
happen.
No, but see, that's people, I don't, maybe it's just Oshkosh or whatever, but I just see it more and more, and I talk since I've been on the board that. Oh, this and stuff, it wasn't even something I had anything to do with years ago, but that's the first thing they say is they're just, and I know they all say it's political, but. I can understand what, just reading, not being political, like, well, geez, that sounds like it's gonna be this. Now you explained a lot more stuff that the person doesn't know,
And
But I know-
it's so
yeah.
important that this group understands
Yeah.
that, so that those of you that actually do sit on the county board, when those naysayers start to speak up, that you can
Say
reply to them and educate them and, speak some truth.
Right.
So, and help them understand and not let them continue to, make up all
right?
these things in their head that they think is gonna happen. It's just not
And you're
happening.
not only that, you have your economy issues now.
I don't know if you own a house or apartment, things are a little tight, you know, you gotta tighten that up belt and all of a sudden, you know, well, I might have to do this or that, but there's an opportunity that you can save some money by doing it this way. And I'm sure this is gonna come up about what you said there, that my cousin does removal of that paint and he can do it for 1/3 what this guy does.
Right.
That's gonna come up because, you know, everyone, anything you ever did to your house, you know,
Yeah.
or what's about the person doing themselves.
That's a
I'll
good
take care of
point.
myself. I can do that. You just tell me the trick, you know, because that will open a bunch of doors, right?
Right, and the fact that, you know, someone out of the goodness of their heart wants to do it and can do it for them cheaper and they
Yeah.
just want to help, but they just don't understand that they could be making this problem 3 times worse and putting someone at extreme risk
Right.
because they just didn't know. And the health department can help educate them. And, you know, they can know that they're doing a good job and really helping instead of hurting in the long run.
So you did the good thing bringing it up because we're discussing. And we're talking, I mean, you know, past, now you're opening all the doors that we're gonna find. I mean, since I've been on the board, that's what I'm thinking about. I know what they're gonna do. 36, you know, tons of questions about the same thing we're talking,
Yeah.
right? So it's kind of good to get exposed here because that's, we're gonna have to get it passed, to get it approved, and you're gonna have to know your stuff. That's all, right? So thanks for bringing it up.
Yep, no,
But we just, we're, and I get nothing, like I said to you, the enforcement thing, I wish they didn't have your name on there, it didn't say enforcement, but, you know, that's what they zero in on. But there's a lot more to it. And I think that's really has to come out more, I feel, that's, okay.
thanks for the feedback. If you have other suggestions or ideas, please let me know. I can remember if those, and definitely work on that. We'll also meet with our council, just to kind of get, you know, their feedback and input on this as well, and we'll at some point, bring it back. Thank you.
So the next item, ordinance amendment on chapter 11, adding the section of human health hazards.
So this is another, ordinance area that we lack language locally. This is an area where we can better support some of our rural townships that don't have any language related to, you know, either building code or health hazards. Brings sections of that state statute and code to the local level. So similar as, you know, we discussed for lead, again, does not increase our authority, but does make it very clear at the local level what's considered, you know, a health hazard, examples of situations that are health hazards that we would respond to. And it's also, you know, just up for discussion. So really, you know, the state code it gives a lot of authority to local health in responding to, identifying, declaring, and responding to human health hazards. And so if you scroll down a little bit here, you can see some of the, you know, examples, you know, that human health hazards are prohibited. And, you know, the types of hazards that, you know, that we see, if you just go ahead and scroll the whole second page there, you know, you can kind of see what some of those areas are. You can scroll up just a little bit, that area. And so, you know, vector control issues are a big potential for complaints. You know, garbage piles, tire piles, mosquito breeding places, rat locations, you know, things that, you know, help provide shelter for rats, abandonment of wells, you know, wastewater. It can be an issue for public health. We have a planning and zoning department for the county that works with us on that. You know, bad septic systems. But we may also get, you know, potentially involved with either zoning or DNR. And then our code is DNR related to other sewage, retention, disposal, that sort of thing. Housing, that's probably housing is probably, I mean, housing and the vermin, you know, the vector are probably the two most common places that we receive complaints about or are being asked to assist the towns with. Most of the cities and larger towns have pretty good language already in their ordinance related to this. A number of them do not. And they will come to us to assist in these types of situations. We have one going almost all the time. I think it just keeps scrolling. So there's so it's basically, adoption by reference, so everything that's already in code, an appeal process and a penalty process, and then this is an example of language that we would work with First Council on. There's a second document that we also included. That one up to this one. Is a little more expanded on definitions. Keep going, please. And so if we let's go up just before there, so the purpose intent. It's stated in a little bit more succinct way. Doesn't list out individual, doesn't list out more detailed information that's available in the state code. Keep going. And I think farther down here, there's some additional, so like these here are definitions of examples of human health hazards, which is nice for people to be able to see, and we've probably had all of these situations occur in the county in the past. So this is again a way to bring state language locally, help us support the townships in a better way. Also, make it more clear for our community to bring forward that state code from multiple places into a human health hazard ordinance.
What's the difference between the black and the red?
And you were making some changes in it.
Yeah, usually when I'm redoing that, when I'm done working on a section, it's in red and then I'll switch it to black, so I may have forgotten just to switch it off to black.
We took some templates from elsewhere and started modifying them, but we wanted to start this process, but we wanted to make sure that we had a lot of feedback before, we took it any further.
So same question, do you
Yeah.
already work under the jurisdiction of the state laws right now? So you're doing all this just under the state ordinance, when you're wanting to pull it into one, but same feedback,
Yeah, that's correct.
yeah.
And I think probably the same thing is it's in the efficiency of dealing with the standpoint of the issue comes up, we can deal with it much quicker.
Yeah, and it's just clear what types of issues, in the local code, what types of issues we actually deal with, or under the scope of, what public health should respond to. Which, working with the towns definitely is helpful.
And it's a lot like the last one, kind of a thing like, how has it been in the past? If you've been able to enforce that, how is it now? And then the next thing, why are you doing it now? That's the first things that come out, why? So would you say the reason we're doing things now?
Yeah, well, part of it's, a more supportive corporation council that, will, that is willing to represent the health department when we have a situation that needs representation, instead of saying it to the district and circuit court.
What happened, I mean, again, now it's open that door. What happened in the past? The council didn't want to get in there, they didn't want to be the police or the lawyers.
Yeah, I don't want to speak for them too much, but
Okay.
it's, it's when we have more local ordinances, there's, more potential for, us to need them to represent us if we issue a citation. So they would need to come to court and represent the health department when we write a citation. right now, they don't need to do that at all, because any citation we write now is based on state code, and it goes to the DA's office, it goes to circuit court. These things are really better off dealt with at, you know, at the local court, not the circuit court, the municipal court, not the circuit court.
Do you have a lot of those now? And either one? No.
Not a lot.
Not many
No, I
citations
mean,
given
we're
out.
always trying to, you know, remedy situations. I mean, citations are last resort. I mean, really. We issue orders first. We give, timelines. We, try to connect people with resources. I mean, we do everything we can to solve a problem, but in some situations, people are just not gonna deal with you.
As long as they're working with us too.
Yeah.
We work with them, we'll give them a timeline, we can get this done by this time, get this done by this time, so it's not like get it all done at the same time. So we work with them through the project, telling them what needs to be done when. We took one, human health hazard that we dealt with over a year to clean up, but he did it. Took him money, it took him time, and he did it.
Cause I can imagine if somebody all of a sudden had some issue with their house and they said it's gonna cost this extra, I mean. They don't have the money. I mean, it cost me 20 grand to do this to my house. What am I gonna do?
Yeah.
It's gonna take a year, probably take more, because I can't get up 20 grand right now. I'm gonna do that. I
You
won't
fix the things that are the most dangerous, first, and then you work your way through.
And a lot of these are around, or about children around, right?
It depends. I
Like
mean,
older people.
I'm trying to think of some more recent ones, like, we had
Like cat hoarding.
the cat hoarding, we had a couple hundred rats in the town of Neenah. That needed to get cleaned up. I mean, they were basically harboring rats that were, going to all the different houses they were across, they knew the city of Neenah was across the street, so they went over there.
Was it there? Okay.
In those situations where, we work with the town, we work with the city, we work with the property owner. In that case, we were able to, a pest control company actually stepped forward and said, hey, you know what? This is a really, this is a really big job, big business, whatever. They came in and really funded the baiting of the rats, and it was minimal cost to the homeowner. And so, in the situation, that's what we try to do on all our situations, is try to pull those resources together. If the owner was like, no, get out of here, you're not allowed to be on my property, and, we have hundreds of rats, and we have lots of documentation. At some point, we may have to, issue an order or a citation to bring it to court so that we can actually address the situation, or, we may need to go to a judge to get an inspection warrant. Those authorities are there, but rarely are they ever used.
But, it's like, I've got a fire extinguisher in my house. How many fires have I had? None. But I've got it there, just in case. I just think it's prudent to have things like this in local ordinances.
So again, if you have any specific questions, or additional feedback after this, please let us know. We'll continue to work on it. We're gonna take it to court counsel, but I just wanted to make you aware that we were looking at this, and we'll come back around after we've done some more work on it.
And we don't need to vote on these, because you didn't vote on the childhood level, we don't vote on the human.
No, these are just discussion.
Okay,
Yeah.
okay.
So we will go to the director and staff update.
Great, thank you. Few points to bring up before staff speak. You're probably all aware that Mike Norton is no longer on the board of health. Maybe you're not. Mike Norton was removed from all his board appointments by the county executive and the county board chair. He still is on the board. Is still interested in being an advocate for health and services for the community. There was an article in Northwestern about it, and also I think in the Oshkosh Examiner, related to the situation that caused him to be removed from his appointments. He has apologized publicly. He has come personally and apologized, and wants to remain engaged. But he will not have any committee assignment, it sounds like, until he's reelected, if reelected. I think he intends to stay on the board, but won't be on any committees. So I just want to make sure that everybody do that. Staffing wise, we've got a couple open positions that we're recruiting for right now. Public health nurse position, a community health strategist position. That was formerly a nurse position that we moved from communicable disease program to our Atlantis division, health lifespan division. We did that because we actually created a new position in communicable disease during the pandemic that we're pulling back now to use for other work. We have a new intern helping Heidi, his name's Kevin, helping Heidi on community health assessment work. We have a new environmental health specialist since we last met, Maeve. So we have four sanitarians, our lead hazard project coordinator that all report to Ann. And so we had a vacancy for quite some time in EH, and we hired a new grad. So we typically are hiring and training most of our positions. It's really tough to find anybody with experience. We're got a couple of the things that we're working on right now. Examining the remaining public health ARPA funds that are available. So there were funds or ARPA funds that were provided, through the state to local health departments to respond to and recover from the pandemic. We're at a place now where the amount of funds that we're using for the response to the pandemic have declined substantially. We have very few staff that are spending significant amount of time on COVID anymore. We maintain our COVID testing and vaccine operations, but those are fairly limited and don't require a lot of regular staff time. We have a few temps that are still working with us. But that allows us now to look forward a little bit more about how the remaining funds that are there can be used for recovery instead of response. And so over the next couple of months, we have funds through the end of next year that we can use to try to address or mitigate some of the impacts from COVID. This is completely separate from the county ARPA funds that came directly to counties and municipalities. So we'll probably have some proposals on that, but I wanted to just get you thinking about that a little bit. If you have any thoughts about use of public health ARPA funds, areas that you think good investments can be made, we certainly want to make sure that we extend an invitation to you to give us some suggestions or thoughts that we can consider in our work plan for that. We're also taking a deeper look into post-pandemic now here, looking into what are all of the opportunities for us in terms of medical assistance or badger care to be doing billing. There's been some changes in what's eligible. Lead's another example of that. A lead hazard investigation done on a lead poisoned child. We can charge to MA now where we never could before. And that's we can recover up to $800 for doing that assessment. That was something we just never could do before. We're looking at our other program areas with Bev, our accounting associate, to identify other potential opportunities so that we're bringing in all the revenues that we're eligible for here locally. And so just letting you know that we're just doing that review. We're providing some support for Tom Egan and the county executive for the ARPA commission. So we started to work with them on just some staffing support essentially to help that committee move forward. You're probably aware from the last county board meeting, proposal to move ARPA funds forward failed, and we're just going to be working with them to make a plan to move forward. So we're happy to provide support for that. We also provided support for when the shelter, the day-by-day shelter, Army shelter had a shutdown. We were very involved with Human Services and the county exec's office on making sure that we could help cover that on short notice. One of our staff, Shannon, was really instrumental in providing services over there. She's also been back at least a couple times now to help train staff over at Day by Day, especially as it relates to substance abuse issues and, you know, help people what to look for, how to recognize substance use, what substances look like, what are the behaviors of individuals, how people might, you know, hide them, or what are some policies and procedures they can do to not get back to the situation where they were, where, you know, they had some problems with substances being brought into the facility. And we'll continue to work with them as needed moving forward. A couple other bigger changes that have come across recently that I'm not sure if you guys will touch on or not. One is childhood immunization requirements for schools have changed a little bit. That has some impact. There's been a change in varicella or chickenpox. In the past, a parent could just simply say, you know, my child had chickenpox in the past, and then they would be waived. It's now a requirement, and a physician or a medical provider needs to sign off on whether or not there's been a previous exposure to exempt them from being vaccinated. There's a couple other minor.
I've got them below.
You got them all? Okay.
Can you run a titer to find out is that what they do, is they to see if a child it actually has had?
I don't think they do that for varicella. I mean, they
Not
probably,
in general,
yeah,
they could, but
okay. It's cost prohibitive. And then, the vertical outbreak.
The titers go on the vaccines.
It does. So if we can just move, we can just hit the step reports now. If you want to start on our second. Yeah.
So for the sanitary program, what Doug said, we hired a new hire. Her name is Maeve Casey. She started January 3rd. She graduated from UWO environmental health program. They have a really good environmental health program, so she came with a lot of knowledge. She's in training. Currently, she shadows our other inspectors for about probably 2 to 3 months. And then, so she's shadowing, and then the next step will be, she will be leading the inspection with an inspector watching her for another 2 to 3 months, and then she'll get checked off on her inspections, like standardized, so to make sure that she's seeing the violation, she's writing it correctly in the report. We had a couple new establishments, you can see, it's not there. We have a new sushi place in Neenah, a farm restaurant in Oshkosh, a farm store in Amro. What kind of farm? Parm, it's called Parm. That's at the Pizza on 21 building. Oh, Highway 21. Sweet Jules Bakery went where Hot Dog Charlie's was. We licensed 4 Airbnbs, and we're gonna have a bar that opens, Tipsy Otter Bar, that's on Oshkosh Ave. And a couple change of owners, the Well in Winneconne, which is a well-known establishment in Winneconne. Commercial Petrol in Nina, Rouge Roadhouse, which is in Eureka, and used to be the Starlight Bar. And Area 44 Pizza, which used to be Pizza at 44. So we've been busy, all those require an inspection prior to reopening, under a new owner or, as a new establishment, so, those are all new establishments that we had to inspect. January is National Radon Action Month, and in honor of this, we sold radon kits for half price. We've been doing this for the last couple of years. We sold them at both Oshkosh farmers markets in January, and we ended up selling 70 kits, which was our new record for the farmers market. So we had a little stand, and people, talked to us about radon, and we talked to them about radon, and we sold some kits. In total, we sold 284 kits for the month, 214 in Oshkosh, 70 in Neenah. And the results are gradually coming in. We had a high of 18.2. So action level is 4. At that point 4, you want to put a radon mitigation system in, just to get that radon out of your house. And we did have a black widow spider come in some grapes at Walmart that we referred to the state. So that was the first time for that. I wanted to include a picture, but it wouldn't let me. It was just the typical black widow spider with the little hourglass on the back. And we've seen scorpions come in on bananas, but this is the first time we've seen the black widow spiders. And it actually did in someone's home. It was in their grapes when they were eating their grapes out of the bag. So that's a little exciting. You see the scorpion come in on a backpack, it was at a daycare years ago, it had gone in the backpack up when they were on vacation and came out, happened to come out of daycare. So this daycare calls up and says, we have a scorpion. And we see the scorpions a lot coming on in banana dances, so, yeah. And then,
Okay, when that happens, what do? You
we.
tell them to step on it or what?
Yeah, somebody usually catches it, and they're usually calling to see what it is. Some people know what it is, some people don't, so they'll call and see if we can tell them what it is. And if we can't, we contact the state, you know, if it's something really strange, we contact this, not the state, the university, the entomologist at the university, and he'll like do things for us.
So do you go back now where that came from, go down the chain to find out, because there's.
So it was because the grapes cross state lines, it goes back to the state, and then the state forwards it to the FDA, and then the FDA will follow up on it. So once it's out of our hands, once food crosses state lines at this, state jurisdiction too, so that one did go to the FDA. And then our lead grants, we have 12 properties approved for the L-SHIP grant. And then one is in process, and work is actually, Scott was working on trying to get one scheduled for the end of February. We have to relocate the people into a hotel. And for some reason, the end of February, most of the hotels with kitchenettes were booked up, so I think he had to put that off for another week. And then 3 are gonna start in March. And then for HUD, our HUD grant, we have 2 properties approved, and then 3 are at the state for approval. So the state goes over our applications, and then they give us their okay, and then, we can get those going.
And so, I mean, so 16 properties approved, ready to go to work. The contractors to do the work. I mean, we're trying to do both at the same time. And it's been far more challenging to develop contractor base because they're so busy already with other projects, and this just takes time away. But they can make more money doing lead than regular projects. So the bids that we've gotten so far have been pretty high. And we're gonna unfortunately have to tolerate that as a local market condition until there's more competition in the area.
So that's it for the wonderful news.
When it's high like that now, you know, there's a normal price and then there's the higher price. How does the grant pay based on whatever it takes, or does it, do we have a base?
Yeah, so we put them all for bid, and then we review the bid, and we review, and with these earlier projects, we're reviewing the bids with the state. Because they know how much these jobs are going for in other areas and can provide just some technical support for that. We've taken some for rebid that were just way too high.
So who takes the hit after it? I mean, you know, you get a bid, and because we're having it across the county and everything we have, you can bid today, but it's gonna be more. One of them was 3 times what it was a couple months back. So, you know, if you got a grant, the grant pays $90,000 for the project, but we just put it out and it's 120. Where does the 30,000 or where's the shortage come? Do we have to pay that, the counties?
No.
Or the people, or they just can't do it?
So, yeah, for these jobs, either the funding's available and approved or it's not, you know, if there's a match component to some of the jobs. You know, for the most part, we're trying to cover as much of it as we can. You know, usually the minimum that we're trying to cover is 85%.
So like those are approved, but you can't get them done now because you don't have anybody to do it.
Well, they've been approved to use the state or HUD funding.
Okay.
They haven't actually been bid yet.
Oh, okay.
So they've all they've said is that, yep, you've met, these properties meet all the criteria necessary for them to access these funds. Now they go out to bid.
And then we have the one that's already been bid out, so that work is starting, and then 3 other ones have been completed.
So everything's pretty much staying to what they've been, kind of, right? You're not having that problem, like. Okay.
They've come.
Okay.
All right.
Susan?
Yes, hello, Susan Garcia Franz with, I'm with the Community Health and Prevention Department, and maybe some of you, I've met a lot of you before, I know a few of you, and but I'm in the role of community health strategist, focusing in on equitable transportation and affordable housing are my two main areas. So just to give you a quick update on the division, is that we've been busy. Housing is one of our primary areas, and we've been Lindsay Erickson and myself have been participating in help of the formation of the Wisconsin Affordable Housing Advocacy Network. So a statewide network that's focusing on affordable home ownership and affordable rental housing. So there is not a Department of Housing at the state level. So really it falls under the Department of Administration, WIDA, the WIDA group that does a lot of affordable housing funding falls under there, but there's not a whole statewide division nor whole network that focuses on this. So we have been working in that area, and it is coming around to formation and putting in particulars of moving some of that work forward. So another area that we have staffing working on is social connection. And there's been presenting on social connectedness work at the Wisconsin Department of Health Services statewide public health webinar in February. Stephanie Gildenvan was able to present and her work that she's done in that area, and that went to a statewide webinar. As far as transportation, we have been working on, I participated with community partners on our Transit Equity Day that happened on February 4th, as it is Rosa Parks' birthday. But we did do an event on the 3rd because that was a Friday when there were more individuals that ride the bus on that day. So we went out to the transit centers and we thanked our bus drivers and our riders for their continued work, keeping the transit system going. And there was handing out of bus tokens and just encouraging our riders generally in our communities and handing out information. And then I also continue to serve on the Community Safety Action Plan. It's working with East Central Wisconsin Regional Planning Commission that's developing criteria for projects to be funded by the bipartisan infrastructure legislation. So that's that national legislation coming down into our communities, working on infrastructure and really looking at safety and looking at areas where we have high crash volumes, but also high crash volumes that that impact pedestrians and bike riders and others that are using our roadways as well. So then they create this criteria, and then we'll be going for grants down the road for those communities to be able to look at those improvement projects. So that's coming late spring into summer. So that is going fast. And then as far as substance use, we have our the overdose fatality review is launching a We Heart You app. It's in the final stages and it's going to be launched in March. Will actually be a promotion event around that. So you'll see a press release, hopefully get press around it. And that app tool, it's a tool that will connect people and families actually direct to support and recovery. So get them the connections that they need to access resources in our community. As far as harm reduction, we're continuing to meet directly with clients, implemented a HIV, HCV, the hepatitis C testing program, and continue to partner with local organizations to offer the Narcan training. That's really been a very successful program with offering the Narcan trainings. And many people are interested in it. As far as breakwater goes, I'm sure all you're familiar with breakwater. I don't have to go into specifics of that, but breakwater, Hannah's been working on partnering with OASD to offer DITEP, which is drug impairment training for educational professionals. And so they had 35 staff members attend a day 1 training and a day two training with assessment skills and response to youth substance use. And that's going to take place in the future. So we also handed out 1,500 doTERRA bags. They were given to Aurora Pharmacy and Hometown Pharmacy to all individuals who are prescribed opioids. That's those bags that really work to neutralize those drugs after use if they have extras. And then the third piece is we're working with, or Breakwater's working with Oshkosh North Communities students on their junior project, and that's going to go until May. So those are the overview. We have a lot more, there's a lot more specifics, but I think those are our high points.
Can I ask a question? Susan, are you somehow, your department's somehow in charge of bus transportation? You said you went to buses?
Yeah, I work on transit issues. Yeah, I work with, we have a couple different subcommittees that I'm involved with that touch on transit. There's a Winnebago Catch a Ride. That's not busing, but that's transportation. That's more centered on employment transportation. It's kind of the areas that fall outside of transit. So first I work with Holly Keenan. She's our mobility manager for the county, and they try to get them, if there's transit available, get people connected to transit, but if it's not available, there's outside programs. And we work with transit I'm on the specialized transportation subcommittee that looks at transit and accessibility issues, especially for our 60 plus age population.
Okay, well, here, I'll just make a question. I have a girlfriend who's in her 50s, has Down syndrome, catches a bus in Neenah, in front of her home every day, Monday through Friday, goes to work at the YMCA. And one of the really cold days last month, and it may have been MLK Day, there was no bus. She did not know that. What do they do to inform regular bus riders, especially those with disabilities like Down syndrome, to say there won't be a bus picking you up on Monday, so she's not standing out in the cold for 20 minutes until her parents realize she's out there and pick her up. How are people informed there's no bus?
Yeah, so Valley Transit and Go Transit have informed me that they do a regular, there's a couple ways. One, they do a regular contact in the bus, like they'll put up signage, or some of them have electronic signage. They'll put it on there. They'll put notices sometimes at the main transit centers. And then there are times when they are through their app, if they're using an app or anything like that, that they're able to put between their social media and on the app. Now, if you're not watching all of those things, you might miss it. So, I can definitely bring that to their attention of that, with some of their users, they may want to take more strategies in those announcements, especially if it's on a day you wouldn't expect, unless you really were paying close attention, you might not expect that day to be one that they weren't operating on.
Yeah, none of the things you mentioned, social media, signs in the buses, none of those would have worked for her.
Yeah.
And if you're not going to be running a bus on a particular day because of a federal holiday or whatever, and it's not like she's got highly educated parents with multiple degrees, and they weren't aware that there was not going to be a bus. Handing her a note on Friday saying, we're not going to have a bus on, but it doesn't sound like it'd be out of the range of possibilities to hand those regular riders a note on Friday saying you won't, the people are getting on the bus 5 days a week, every day. You won't have a bus on Monday.
Right. I think that's where make the ride happen could have been a connector on that day. But again, you'd have to know that and have that number and, all the pieces available. So I think you have a totally valid point. It's like I think we bring to the attention of the transit systems on that now that I'm on these subcommittees. That's a way to elevate that, because I think sometimes they don't think about the scenarios. They don't know until they hear them. So I want to say they really do a good work of trying their best to be as forthright on when they have changes. But I agree that there's certain ways that they think people are seeing those. And so they might have to think a little bit more outside the box next time.
Thank you.
You're welcome.
One thing I just have, but sometime if you could for us on that housing, it's very interesting, the housing, the ownership, what you do and rentals, it's kind of important because I know there's a lot of different projects around the city or they're trying to get different housing. And they're coming up a little bit, people don't want certain people to come into town now, all of a sudden, I heard the last couple of things, projects are kind of holding them up. So I'd be interested in what you're doing in the area or how that's been going. I mean, and some of them I heard were coming up, they're gonna be like $1,500-$1,600, which is not affordable for normal. I mean, you get the mortgage, and how do you even get to the $700-$800-$900 people? I just that would be really interesting to talk about that one time if you could give us some more information. Now, you don't have to do it now, but I mean, that area is a big thing for us in this area, I think.
Absolutely. And we have a beginning PowerPoint presentation put together that we can present. Lindsay and I working together. I'm also working on with some community partners on adding more elements because things constantly are changing in this arena of, money, state initiatives along with local initiatives. So we would love to present on that in the future. So I'll work with Lindsay on that and get that on your schedule.
Yeah, because I know I was in the car business, but when the prison came up, it was one way, and then all of a sudden, as the prisoners got more and more, I'm seeing more and more families coming up here. Again, we talked about a couple of things today where they come here, they aren't from here, from Chicago, wherever, their relatives incarcerated, they want to come up and be around them. They don't know about the programs that we offer. They're having a tough time finding housing. And when they do try to find housing in the housing area, a lot of places don't want to build housing and they don't want that person in that because worried about their neighborhood. So there's all that kind of flying around right now. And housing is important for so many people. The tiny houses is going good. So I just, that's an area that we really have to dig into and see. So I appreciate their time on that. Appreciate it.
Absolutely. Absolutely. Yes. Thank you so much for those questions. All right. Thank you.
Now, Jamie was already presented, so we go to. Who's that for Julia? She is that right?
Julia's on, okay. Perhaps she won't be speaking. Julia's not feeling well this morning. That's the reason she was out.
Yeah, she left us notes. So yeah, we're working on the annual report. I don't think done soon. We'll have that to you guys. We tried to take that, the COVID-19 update. We've been working on this for a while now. We had a big increase in social media contacts and email contacts during the pandemic. And we're really trying to leverage that into greater community education about what health department does. Now that we have a bigger list of people that are interested in what the health department's doing, we'll see if they stay on or not. And so, yeah, it's an example of our most recent one, which you should also be receiving. Continuing to work on our community health needs assessment. That's a data collection activity that leads into a community health improvement plan. So community health needs assessment we're working on as a health department and also with our area healthcare systems. And so we'll be continuing that through the next several months and then transition to a actual community health improvement plan report where in that report we try to identify priority issues for the community and how the community can help participate in addressing those issues of need. And what's on there? Yeah, lots of discussion, not only at the county level, but within the department too, about onboarding and retaining staff. Obviously pay plan was being addressed. We're hoping to see some results on that. And we're also trying to be conscious of, what are the supports that we can provide within the department that help employees function at their highest level and also help them feel supported so that they stay. Yeah.
All right, so I'm going to talk about COVID and monkeypox, which we also have listed below. But
Yeah, you may cover it all.
Yeah, we'll get it done now. So with the plan to end the national emergency and public health emergency, there are plans already for DHS coming out, so we're keeping an eye on those. FDA revised their emergency use authorization for Heavy Shield, so it's no longer currently authorized for use, emergency use. We still have Paxlovid, which is the primary one that we use for COVID.
Antiviral,
Antiviral.
yeah, for treatment right after infection.
For our vaccine clinics, we're consolidating those while maintaining availability for the vaccine boosters due to the decreased demand, but we still have it available. Monkeypox, February 15th, they maintain alert. Who does for national around the world, although we have not seen much in our area. The case rate has completely dropped off in the US, but we keep it available for vaccines. Ebola, that outbreak ended in January 11th worldwide. They had 2 incubation periods without a case, so we don't have that effect anymore. Triple demic, which is what we were talking about quite a bit last year. Looking at nationwide ER visits, I don't know if you want to click on that. RSV and influenza peaked before the new year. COVID has not seen the large increase that we've seen in January, February of 2022. So that is good. At this point, we're doing well. We are seeing an increase right now, but it's not like it was in 2022. But we are going to, yes, those are looking much better. GI outbreaks, we're done with that one. We're seeing a lot of seasonal rise that we normally would see of GI outbreaks. It is higher even than our normal levels. In the past 2 weeks, we've had 1 long-term care facility and 2 elementary schools with what we suspect is norovirus. Good thing, just as a reminder, you know, our antibacterial wipes, so sometimes it say kills 99.9% of bacteria and viruses. That does not have bleach and is not effective against norovirus. You really have to have something with bleach in it. Clorox, the brand name, doesn't mean it contains bleach.
Oh.
So,
They even advertise that they take care of COVID too.
oh yeah, it does, but it doesn't do anything for norovirus. So, we suspect that issue. So that was good education for those schools and such. Outbreak of extensively drug-resistant Pseudomonas. They had artificial tears, so we're promoting that so people know to look at their bottles and stuff that's at home. So they're nationwide, that's been going on for the past year. They're looking into cases and they're seeing it now. So if people have anything on their shelves related to that, please remove it. And then we've gone into the change the administrative code 144, reminding us of the history exemption for varicella. Although, just to kind of let people know if they don't want to get, if their physician is not going to approve because they haven't seen it, it's fine. You still have the exemption option or to get vaccinated. Either is your choice and you're still in compliance. TDAP, we're now requiring students entering 7th grade to have their TDAP, which is a good move. The schools are struggling with it to get in 6th grade because physicians go by age, not by grade. And you were bit of a discrepancy. Meningococcal, we're now requiring a dose for students entering 7th grade and a 2nd dose for students entering 12th. And there will be a little bit of that grandfathering students who are going into 12th grade in the next few years, who only have 1 dose are compliant. We still have the medical, religious, and personal exemption. Changes will be implemented in the 2023-2024 school year for schools and are immediate for daycare, childcare. Any questions? I started with that.
All right, on to the Healthy Lifespan Division. Our Family Child Health Team is looking to hopefully present on the state of early childhood to the county board supervisors on March 7th. We haven't finalized that schedule, but hoping to be there to kind of set the stage of what we've seen the past few years with COVID, where our developmental rates are and what partners are really looking at in the community. There is an expansion right now happening at the Oshkosh Boys and Girls Club. They are building a new community center and they have reached out to us interested in perhaps having some more stable satellite locations there for us to service their families. So an example would be like Jamie was talking earlier with WIC, being able to go over there a few days. We might be able to take our partner resource hours over there. So those conversations are going good. If you're interested, they do have a website and a presentation on that. A few of our staff were just learning about it and surprised that it's already set to happen early 2024. Building will be done. Parent resource hours are going well. Our March theme is developmental screening, so parents are welcome to stop by anytime during those hours and get a developmental screening or just learn about the process and how we're collecting that data and how it's moving our local priorities forward. The Wisconsin Well Women Program had great numbers for last year. We are definitely rebounding since COVID, back up to good numbers. As you can tell, quite an increase in the last year, and already this year, our enrollments are on track and very high for new enrollments.
Can you pull it up so we can see Winnebago County? Okay, thank you.
It's common for women that get on the program to re-enroll, and so our staff reach out when it's that time of the year to re-enroll. New enrollees aren't as common every year, as you can see from this. New enrollments are usually just about a fourth or a third, but right now they're closer. They're usually about a fourth. Right now they're about closer to a third of our enrollments right now are brand new people. So that means the referral system is going well. We're doing good getting out to providers and then making them know that we're here and available. Also, just having that staff capacity back after the transition and training. They are also working a lot on the emergency order. With that happening, a lot of people are calling with questions, and our well women specialists are kind of in tune and able to send them where they need to. Wellness classes going well. So the strong bodies stepping on, those are really flourishing now. It's one of those classes that you can sign up for 6 weeks, and we're finding a lot of people just want to keep going. They like it, they like the group that they've signed up with. So many of them, even though the intention is to hold them quarterly or maybe just twice a year, the communities are asking that they just continue. Like the class gets done, maybe take a week off for the leader and then start again. So it's a good problem that people are so interested, but lots of classes going on, keeping Joanne busy. Doug did mention that there are 2 positions currently posted. One replaces Teresa Paulus, the nurse that just retired the last 2 weeks, and then another community health strategist. I've been in conversations with the Human Service Department and ADRC. They're really excited to hear that we're going to be expanding our capacity to visit adults in the home. They've had some crisis, urgent moments where people just need that transition help out of the hospital, getting set up on medication before they're really enrolled in that long-term family care or home care. We can be that safety net. And also came across this free self-paced free training, and it's on how to be an anti-racist in everyday practice of public health. So just sharing that out if anybody else is interested. Our team is taking that on the next few weeks.
I have a question going back to something you said. Doug, sorry.
No, okay.
Sorry, I used my finger. Can you remind me at which time John Damo cut a position? Did we replace that with a different name, or I just don't remember what happened there?
Yeah, so John pulled out policy and equity position out of the department. We did add at budget time a harm reduction coordinator, which we were planning to add anyway. And that is where our TO sits now. So we've not, we've been without that position. We're doing what we can to try to backfill the work that was done by that position.
So then all this work that you're helping Damo with, is that hurting your staff? With the ARPA funds, like your staff seems to be stretched as it is.
Yeah, I think it is a pull from our staff and from my time to assist with that. But we consider it a fairly high priority issue that has, a lot of public health benefits potentially attached to it. And so, we're by supporting the committee, we hope that, we can advance, the use of those funds in ways that are really productive for the community. But yeah, it is a stretch.
Okay.
No doubt. And we'd love to have that position back.
Yeah, yeah.
We need that position more than ever.
Yeah.
The county executive pulled that position out I think he thought, well, told me he thought he was doing us a favor because he knew that we were gonna be facing a lot of criticism about the whole COVID pandemic, and use of funds, and, I think he thought that that was gonna help us move through the budget process more easily.
We love it.
Yeah. So if no more questions, we'll move on to the 2022 year-end income statement review.
Yep, make it quick here, we're over time. This is as close as we have as to year end. I don't know if Deb's still on, and she might have a comment or two after this, but you know, if we just kind of look towards the bottom line, we from what our submitted budget, we've received about 77, over 77% of the revenues that we had budgeted for. There's fairly large amounts of COVID funding in that we haven't utilized or didn't need to utilize in our response. As I mentioned earlier, our expenses came in at a little over 73%. And in the budget for last year, we allocated $830,000 from reserve to offset the budget. And so where we stand right now is we're short of that 800,000. We're at I think 484,000 into our reserve, the remainder of which then just wouldn't come out of the reserve. And so at this point, we're in that window of those reserve funds. We probably still have some revenues coming in yet. If that's oh, I didn't even know we had that one. So, okay, that's nice.
Sorry.
No, okay. I didn't see that. I didn't see that document. I was just pulling it off the regular income statement. And so we're under budget. You know, we're at least a few $100,000 under budget from what we put into place at the beginning or planned for 2022. And those funds that were under budget just will either, some of those may get carried over into 2023 as we're doing carryovers now, or they just won't come out of the reserve, and the reserve will remain at a higher balance. Happy to answer any specific questions. If Bev's on, please feel free to jump in if you have anything else. We like I said, we may still have some revenues that we haven't realized yet, but the books are basically going to be closed. So any revenues that we receive beyond this will probably apply to the 2023.
We actually have until June to receive back any grant revenue for 2022. And yes, we have quite a bit still coming in.
Any ballpark figures on that, Bev?
No, I would have to look. I'm not sure.
So we can still count it in 2022 if we receive it by June.
Yes.
Okay, great. Thank you. So we don't really have a final, you know, income statement for last year until June.
What is it, I mean, just so I learned, what is the benefit for 2022 or just take it over to next year? Is there any benefit or is it not?
If it's put back into 22, and we haven't made a provision to carry it over to 23, it'll just end up back in our reserve fund. If it's pulled into 23, in order to expend additional monies beyond the budget, we'd have to do a budget transfer to expend those. Otherwise, they would just wait until the end of 23 and probably go back to our reserve. Anything else, Bev?
No, I don't think so.
Thank you.
The COVID-19 monkeypox, any more on that, or?
There really isn't much more. I mean, the response is winding down. I mean, we are seeing an increase in cases right now. But we're still at a low community level. We're at a medium community level based on hospitalizations. Those have been trending down, so now we're back to a low level. But cases have ticked up a bit recently. Hopefully, I think what we're seeing now will be the worst of that. Yeah, so really not much else other than that we're still, we still have operations going for that. And that'll continue until we hear more, from the feds the state will stop supplying vaccine probably sometime this year. In which case, we won't be able to offer it any longer for no cost. And testing is likely to probably ramp down by May. We'll probably be gone. Our primary, we're transitioning by trying to make sure that there's free test kits available in locations in the community. They're of course available in the stores, but you know, we've been ordering as many as we can to get them out. I see that, you know, that whole piece there is gonna fold, you know, in the coming months.
So it looks like our next meeting will be April 21st, unless you need one before that.
No, or I don't have any other needs identified this past week. And we of course can have one in April if there is something that the board would like to, you know, have a meeting for.
And then the reports for the Board of Health.
I would, I'd like to make just a couple comments. I've already thanked people at Human Services for the work their staff did for the warming shelter during that crisis and at Christmas. And I want to thank all of your staff, whoever was involved in that, jumping in and saving lives and keeping those people sheltered, and I appreciate that. And the second thing, which only slightly might, but I've been mentioning is at board meetings, in committee meetings. A church that I don't attend frequently, but I was there the first Sunday in February. Trinity Episcopal Church, across from the Christine Ann Center, announced that they were purchasing $1.2 million in medical debt. It's a group nationwide called RIP Medical Debt, and it's only $12,000 to buy $1.2 million of medical debt in the state of Wisconsin. And so they hope to wipe out debt of $1.2 million worth of debt for residents in Wisconsin who cannot pay. As it is right now, medical facilities and stuff, hospitals, doctors, they sell this to collection agencies for the same price. And then they hassle people, but this way churches around the country are buying medical debt and donating and forgiving it. So check with your local, whatever church you attend, or if you want to be involved in the one that Trinity is doing, you can contact Trinity Episcopal Church in Oshkosh, across from the Christine Ann Center. They hope to have that money raised by sometime in May, 1st of May, the end of May. That's their goal. And they're about 15%, 20% there now.
And the group is RIP.
RIP Medical Debt. So if you send the church a check, be sure in the memo you put down RIP Medical Debt. That's where it goes. That's all I have to say.
The only thing I had is I had the honor to go to NACO this last week, and it was really interesting. I've got a whole suitcase of stuff that I brought back to go through. Went to a lot of meetings about, so I got a lot to bring back, but it was very interesting what you learn compared to other counties and other supervisors. Some are called judges, some are called commissioners. I mean, it's unbelievable how every state and county is different than what we are sometimes. I did get the one thing that we were the second largest county board. Most of them are 5, 7, or 9. So this was on the here 36. That was kind of like, what? So it was kind of interesting. I got I think 37 different business cards. I connected with this administrators and others, so get some information back and forth, so you share some ideas. So I'll pass that on after that. But it was very interesting. And I got to go to the Capitol too. So we got to do a lot there. Capitol here I went to the week before, and then I went to the US Capitol. So I got to connect with a lot of people, got a lot of information. So I appreciate the opportunity to do that. It was well worth it.
We usually get a few questions around that time, from supervisors about if we're doing a program or if we have a grant or something like that. So it's always good that.
I had a question to ask you about how we do it, because in our county, it seems like there's a lot of different places. They don't have enough people to apply for grants. That was a big thing, because on the other side, they said there's tons of grants out there that people just haven't had the people to go and apply for. So there is lots of money flying around. So that's one thing we should try to improve if we can get help, or if we don't have help. And I know
couple times, they said at the last meeting, they hired an extra person in the office that's supposed to help grants, right? So I hope that works because there is money out there to get it, just getting the time to get it, because they said there's so many out there that people have not applied for or a limited number. And there's still money sitting there, so to try to get that, that's good. And the only other thing two things that I get was, I told you about the partners. You know, but I think I'm just finding out that we have a lot of partners, a lot of people that are doing homeless or doing other things out there. And I think sometimes when I go and talk to them, they aren't as educated as I thought they were, which is like me, because as a new supervisor, I didn't find out a lot of stuff until I got there. So I don't think we should kind of miss out that opportunity that to go back every once in a while to somebody that we think knows about what we do here, what we don't do, and reach out there, because they have new people, some experienced people are gone, there's new people there, they have no idea what's going on or opportunities. So I think we should try to keep that door open at all times to go through. The last thing, again, doing through books and reading, is that in coming budget time, a lot of places are kind of going through their whole staff and everything, and a lot of them aren't throwing money just to throw money because, well, we're trying, let's do this. But they're looking at where are the benefits coming? Are we getting good stuff out of this? Do we need more help here? Is there other areas that we're not getting much out? We keep giving you money because the budget says that all the time. So always look what we can benefit the public more by contributing more. And the ones that aren't, we have to change that or combine it with something else to make it worth. But we should always look at that, because a lot of the budgets in the past, a lot of them were talking about, well, we do a little bit from last year. But we really didn't take the structure of the people, what we have going now. And this one here is getting unbelievable results, but they get the same amount. And then this one down here isn't doing much. We aren't hitting the public, so maybe we should combine it with something else and put that money towards something on the top. So that's just some of the things I learned. It was balancing in that. And so I'll bring that to you. I got plenty of pamphlets. I'll bring that and plenty of connections, because I already got a bunch of them reached out to me saying they were glad to talk to us about it. And so they do recognize us, because we had a few people there where some people in their whole state sent one person. Whole state and all the counties they got. So we had pretty good, we hung around a lot of people from Kenosha there. So it was kind of interesting that way, because you reach out to more people. Same thing, we are, ARPA funds were talked about. Some have already doled them out already and done some. Most of them didn't get a lot of money yet. They haven't got it. They're waiting for it to come and pay. But most of them have considered or decided on what they're gonna do with it. So, again, good stuff. So I appreciate the opportunity to go. Thank you.
Apologize.
I always feel bad. I just take the meeting longer because I ask questions.
Then if I can have a motion to adjourn,
So moved.
Second.
all those in favor?
Hi.
Thank you, everyone.
Thank you.